Doctors, we are live now. You can start the session.
Thank you, Sai. Good morning, everyone. Welcome to this webinar today. The slides are visible?
Yes, sir.
Yes. Okay. So let's start with a recap of our lives. How does the life of a VR surgeon go on? So all of us have taken care of VR with pride and with head held erect and brimming with confidence. Of course, we are the neurosurgeons of ophthalmology. Heck, we are actually better than the neurosurgeons. Our instruments are much smaller. Our playing field is 1/100th of that of the neurosurgeons. I hope that my neurosurgeon friend Satish and Swarup don't hear this. But then we get on with lifetime of bad posture, bad habits, and poor ergonomics. And the once erect neurosurgeon has to be ultimately propped up with braces all over the place. I just realized that Divyansh has copied this posture of mine from my in-between cases, and I think he's making a parody of me. Ultimately, we land up battered, bruised, and contemplative with a host of melodies. We have a heartburn. Our cataract and refractive surgeon has bought his second Mercedes, and we are still paying the EMI for our first car. Neck is gone, thanks to years of LIO and indirect ophthalmoscopy. Back is gone, thanks to hours of vitreoretinal surgery. Our brain is in mental turmoil and depression, thanks to the diseases which we treat and the patients we handle. And you can see the surgeon is pointing out to something in his forehead. I think he has sustained physical abuse as well. I don't think it's domestic abuse knowing Kirill, his wife. Maybe he sustained the physical abuse somewhere else. So welcome to this session on physical and mental well-being for the VR surgeon. So the whole session is aimed at making our lives better and healthier and happier. Thanks to our speakers, panel, and moderators, they have readily agreed to be part of this webinar. And the panel is comprised of well-known, established vitreoretinal surgeons of repute and who have been in practice for many, many years. So they must have been there, done that. They must have gone through all the physical and mental turmoils of VR practice over their years, and they'll be sharing their pearls of wisdom with us. Dr. Natarajan, Dr. Muralidhar, Dr. Munna Bende, Dr. Kim Ramaswamy, and Dr. Shobhit Jala need no introduction at all. So amidst them, they have about 150 years of cumulative VR experience. Don't ask me how I reached this number. I just calculated the number of years they have been in practice multiplied by 5. My arithmetic skills are quite poor. And the webinar also gives me a unique opportunity to learn from my teacher, Dr. Ligam Gopal. And the uniqueness is I am going to learn from my student as well, Dr. Shweta Suryakant. So I have specifically told her not to teach us these kind of postures, and none of us want to land up in a neuro ICU after the webinar. And so this is how she looks when she is not contorting herself doing yoga. We have a panel of expert speakers, Dr. Saravanan, who has years of surgical experience behind him and number of patients whom he has treated. So he's going to talk about the ergonomics. And Pradeep Sagar, a young surgeon who got into experiencing the maladies of VR surgery and VR practice much earlier in life and how he overcome that. Dr. V.S. Saril, ergonomic specialist and rehabilitation specialist from Chakra World Hospital, and Mr. Srijit, who is a corporate trainer from the Art of Living Foundation. All are expert speakers who will be guiding us through the next few hours. And we have moderators, 2 young ones and 1 young at heart one. And they are the dynamic moderators who are going to take us through the whole journey. No, I didn't mean that young at heart one is this person. So pick your, you can select your pick from the other 2 people. And lastly, let me give credits to the team which made the movies. The concept and the props are from me. Yes, the props, the neck collar and the shoulder brace is from me. And the star of the show is Divyansh. and I have to be careful in giving such opportunities to him anymore. With his good looks and acting skills, he may leave me for lucrative career in Bollywood. And supporting cast number 1 is Pretty Pooja. And there is another supporting cast number 2. If you notice carefully, there is one person standing there without twitching a muscle. He gives a stability to the whole scene. Kader the Rock. And the location is Shankarai Hospital, Bangalore. And the whole thing was directed by a young, talented director from Bollywood, Ms. Ushma Vora, who actually did the cinematography as well. In case you are thinking of hiring her for your next movie, you need to wait a few more months until she finishes fellowship with us. Now I invite Dr. Madhu. Anytime I meet him, it looks as though he has just stepped out of the gym to start the first session. Thank you.
Thank you, sir. So, am I audible?
Yeah, you are.
So we'll begin with the first session. Thank you for this opportunity for the DRSN, sir. So the first session is taking care of your back, ergonomics and posture. So we have two very experienced speakers in the first session. The first speaker will be Dr. Pradeep Sagar. He finished his post-graduation from RK Center AIMS, and then he went on to do his fellowship with under the guidance of Mahesh sir in Shankara Institute. After that, he is working as a consultant at our Shimoga unit. He has published several papers. He has participated in several state and national and international conferences, and he has won few awards also. So the first talk will be by Dr. Pradeep Sagar on LIO and indirect ophthalmoscopy lesson learned. So he's going to teach us both as a surgeon and as a patient. Over to you, Dr. Pradeep. So I request the audience to please type your questions in the chat box so that we can take up these questions at the end of each talk.
Am I audible?
Yes, Pradeep, loud and clear.
So, good morning, one and all. At the outset, I would like to thank Vitreoretinal Society of India for giving me this opportunity. I'll be discussing care to be taken during indirect ophthalmoscopy and laser indirect ophthalmoscopy. It was just 4 years into VR practice, and I developed cervical disc prolapse at the level of C5-C6 and had a compression at the C6 nerve root. I had severe pain and radicular pain in the left arm. Most of the spine surgeons suggested that I have to undergo a surgical intervention if the symptoms does not subside. It was really scary. It was just 4 years into practice and still a long way to go, but I was not able to work or travel. It took almost 2 to 3 months of rest, physiotherapy, and medications to get back to a normal, rather I would say a near normal condition. So this is not just my story. If we go through the literature, we come across various surveys which show a high incidence of musculoskeletal diseases among ophthalmologists. The data is really alarming. Up to 8% of ophthalmologists require surgical intervention to treat work-related musculoskeletal diseases, and 9% were forced to give up operating prematurely due to chronic pain. If we go by the survey on VR surgeons, it was noted that 55% reported both back and neck pain. Only 15% were asymptomatic and 7% required a surgical intervention. A survey in India showed that performing retinal lasers and indirect ophthalmoscopy has a strong association with a chronic backache. So why indirect ophthalmoscopy is harmful? We need to understand a few basic things to understand how it harms our back and neck. We should understand what is a neutral position. Neutral position is one in which the neck, the muscles, the tendon, and the joints are at ease. So this is the neutral position in which the head is directly on the spine, and we can see that the ears will be just above the shoulders. A forward head position increases the weight of head on the spine. As we can see here, a forward head position leads to a significant increase in weight of head on the spine. A flexion of more than 20 degrees, that's the neck flexion, causes severe strain on the neck, and it is okay to flex between 0 to 20 degrees. So we can see here, even with proper technique, the ophthalmologist is forced to maintain abnormal posture during indirect ophthalmoscopy. This is almost an ideal table height, but still we can see that the neck has to be flexed, which is away from the neutral position. And sometimes, like as we can see over here, to see the superior periphery, we have to bend so much so that the entire back, neck, everything is bent. So this causes strain on the neck and back. So how to reduce the strain during indirect ophthalmoscopy? Choose a lighter indirect ophthalmoscope. I repeat, I don't have any financial disclosure or financial interest over here. So a lighter indirect ophthalmoscope is better, as if the viewing system is heavier, the weight is directed downwards and it causes strain on the neck muscles. When doing indirect ophthalmoscopy, we really don't feel that it is very heavy, but once we have to understand that we do this regularly for years together, and finally this will definitely have an harmful effect on the neck. The other measure is maintaining or adjusting a proper height of examination table. As we can see over here, a table which is lower needs more bending, whereas a table which is appropriately adjusted does not need excessive bending of back or neck. So when we bend excessively, we can see here that the head will be forward, and this will lead to excess weight on the back, which will cause strain on the neck and back muscles. So one more thing is restrict the use of indirect ophthalmoscopy for periphery screening. As we can see over here, for a peripheral screening, we need not bend our neck excessively, whereas for seeing the posterior pole in supine position, we have to bend our neck or flex our neck excessively so that it will cause stress on the back and the neck muscles. So better to use a slit lamp biomicroscopy for examination of posterior pole and mid periphery, and restrict the use of indirect ophthalmoscopy for periphery screening. We know that slit lamp biomicroscopy has a better magnification and better depth of perception, and it's also helpful in assessing the disease. The other option is to use a sitting posture. The advantage of using a sitting posture is that we can examine the patient with neutral position. As we can see over here, I'm maintaining an exact neutral position, but still maintain to examine the fundus of the patient. Here we can see that even with an ideal posture, the neck has to be flexed when we are examining in a supine position. It has an additional advantage that the back can be supported on the backrest so that the strain further decreases. But the issue is that we will not be able to examine the superior and inferior ora clearly with sitting posture, and scleral indentation is not possible. And again, when we are using a sitting posture, we have to maintain proper positioning. We should make use of the advantages it offers, that is maintaining a neutral position and using a backrest. If we don't use it, the point of using a sitting posture for examination is really not helpful. So as we can see, excessive bending during indirect ophthalmoscopy, even in sitting position, has the same adverse effect as what it has with the supine position. So always try to rest your back and maintain a neutral position while recording findings or while counseling the patients. We should maintain a neutral position, support our back while recording our findings, and even while counseling patients. if we bend forward or we are not supporting our back, the strain which was there during examination continues to be present even in between examination, and the harm is more. And most important is strengthen your neck and back muscles so that even if we have to maintain an abnormal posture, this strong neck and back muscles will prevent any harm to the spine. Because we are forced to use a supine position most of the times to do a proper indentation during surgeries like scleral buckling, during laser indirect of thermoscopy. So it's not always possible to maintain a neutral position, but try as much as possible to maintain a neutral position and make sure that your neck and back muscles are always strong. When coming to laser indirect ophthalmoscopy, there are additional issues other than the indirect ophthalmoscope itself. The viewing system is definitely heavier when compared to an indirect ophthalmoscope. So there will be more strain on the neck muscles, and particularly while performing laser for a longer duration, like ROP laser, we have to flex our neck for a longer duration with a heavier viewing system in front. So it's really painful. So how to reduce strain? One option is restricting the use of laser indirect ophthalmoscopy for anterior lesions, which are not amenable to slit lamp delivery, and prefer slit lamp laser delivery for posterior lesions. When performing a longer procedure, take breaks in between and make sure that you rest your neck and back during that break. You may feel that we will finish off the work early and leave, but it's better to take break in between and work for a longer duration rather than finishing that work on that particular day early. So future direction, in cases with loops, there is a thing called ergonomic loop. Here we can see that the eyepiece is directed downwards so that without an excess flexion, the examiner is able to see the patient easily. So development of such design with IDO may be beneficial in future. To summarize, always try to maintain a neutral position, avoid excessive flexion of neck and back, use a lighter indirect ophthalmoscope, maintain a proper adjustment in terms of examination table, restrict indirect ophthalmoscopy for peripheral screening, try to examine with sitting posture whenever it is sufficient. I don't recommend that we have to examine in sitting position because we may miss a few findings and we may not be able to do a thorough examination. But whenever it is sufficient, we can try to get away with a sitting posture. And particularly if you already have an issue earlier, like you had already had a neck or a back problem, it's better to use sitting posture whenever it is sufficient. Take breaks while doing laser indirect ophthalmoscope. Rest your back, strengthen your back and neck muscles. Thank you.
Thank you, Pradeep, for that wonderful presentation with a lot of illustrations, which is much more needed for everyone, including the freshers, the young surgeons to the well-versed surgeons. So Dr. Natarajan has reiterated the point that many of us may not use a backrest, and even if it's available, it cannot be used properly. Instead, he's suggesting that we should strengthen our muscles, protagonist and antagonist muscle, and he prefers dancing to that, which is can be a wonderful thing to keep us mentally active also. So are there any comments and additions from the other panelists?
I think you have to prevent, not he concluded that if you have a back problem, you have to take care, but I think you have to take care from day one. And I remember Steve Charles mentioning that he uses a gym in between. I don't know whether it's advisable, but my gym trainer always says don't do weight on the day of surgery. And that's only for toning of the muscle, not for muscle development, but you have to keep all the muscles strong. And that's what I think I realized, and I'm fortunate, except when I have also designed for surgery, hand rest, back rest, and also wrist rest, which in somehow nobody is making it, but I have my own self-design for all the OTs I go. So when we're operating in Kashmir, then I developed back problem because there was no back rest, there was no hand rest, and So actually, the elbow weight the shoulder weight goes to the elbow, and elbow weight goes to the wrist, and then you are concentrating on your neck also as a problem. So I think the best is to do exercise.
That's a point well taken.
I think one very relevant point which was raised was restricting the use of indirect ophthalmoscopy in lieu of slit lamp examination, and also doing slit lamp where it is possible. But if you restrict that, well, about 20 years back, when I developed a little problem, I restricted that, and of course, yoga and other things with it. Haven't looked back. It has suited me very well. And you don't require a full peripheral exam in every case. So I think it's very important to weigh, and of course, using a light indirect ophthalmoscopy. Thanks.
Your comments, sir. So my question is to Dr. Mahesh, sir, and Dr. Mula, madam. Like, we have to balance between the two things. Like, you should not miss the findings because the patient has come to you and you need to inspect each and every part of that. How do we balance between like an indirect in every case, or is there a protocol which an institutions have set, like okay, in these particular patients, or at least in the follow-up visits, the IDO can be skipped and we can do it only with the slit-lamp examination?
Actually, Madhu, I have the reclining chair, and I use the indirect most of the time with the sitting like 90-degree position for the patient and me. And if I really want to depress, then I put the thing back little. And now with the experience, I can even see the periphery without depression also. And I think even rheumatic detachment, you can look at all the breaks without depression. But if it's really required, then I put the flat, but it's rare for me. So main will be to, most of the time, you have to be aware of you're straining your neck. And when the day or time you're aware, I think one is exercise, and second is don't do that first. Then I have a protocol. I think it will be different for each one.
Right.
And idea will be not to miss the finding.
Yes, sir. Thanks. Ma'am, you wanted to comment? Ma'am, you have to unmute yourself.
You have to unmute. Muna, you have to unmute.
Yeah. Thank you, Pradeep, for a very interesting and relevant talk. I think what problem many of us face is we are using ORs and OPD rooms which are multi-user. So today I see, tomorrow I do surgery, tomorrow somebody else does it. So it's very difficult to personalize your equipment in the room in most situations. But we have to realize that a lot of chairs go up and down, a lot of tables go up and down, and we have to make that time to do that adjustment at the beginning of the day. And the height, usually if it's a little below your waist, it's more comfortable. For people like me who are average size, touch wood, I don't have a problem as far as height is an issue, but people very short and very tall can face that problem as well. So I think for multi-user rooms, we have to make that adjustment at the beginning of the day.
Thank you.
Thank you, Madhu. There was a very, very interesting presentation with Pradeep. I think he covered a lot of. What's important is for the youngsters who are starting to learn indirect ophthalmoscopy and then continuing should have this in their mind when they start, because what you learn is what you continue to carry on. And the other thing is, maintain, like many a times I have 2 or 3 physiotherapists who will come as an attenders to their patient, observe me and then tell me, sir, you're sitting in a wrong position. The way you're, all that, if you're conscious, as he pointed out, that's very important that each one of us, especially as you go into your practice, the more cases you start seeing, you become very unconscious of all these things when you start, examining the periphery, retinal periphery and all that. So that's something we have to be reminding ourselves of what we are doing. And then the other thing is stretching between, cases. That's something my teacher, Dr. Nam, taught me how you should, even simple exercises in between helps us to relax our muscles and then, continue with the work on. So it's important that we are conscious of what we are doing.
Thank you, sir.
Dr. Cyril, you have any comments on the ergonomics of what was showed?
Sure, sir. Wonderful session. Thank you. And what I would like to add on is keep in mind all these points are quite relevant. The important thing about a posture, as far as we consider in ergonomics, is how long are you going to hold the posture? So if your procedure is going to be not taking much time, it's okay to be in a little bit of a wrong postures as well. But the issue here is what postures are becoming your habit. That's the key point. All of us need to be more mindful about what's the posture that we are most comfortable. And I'm stressing on the word most comfortable because many a time comfort is what we are conditioning ourselves. And it does not need to be a good one on the body. So become more mindful about the postures that we often fall into and then try to come out of that. So habituation is the key over there. Whichever procedures that we do. So as the doctor said, the another people in the room. So like this forum, everybody is becoming conscious and aware about postures. I think this is the right beginning or the right kind of an approach where if I'm going wrong continuously or constantly every other day, my colleagues can correct me. It's kind of very difficult to have that insight all the time because we feel so comfortable in those postures. Like our parents or teachers would have always told us like sit straight and upright and things like that, but it's difficult, we fall back. So it's good to have your whole colleagues also be aware, even the nurses, all of them be aware so that they can be the guardians who can correct you when you are going to. The point is, if it's going to be a long procedure, 2 hours or more than that, it's better to be very, very careful to have changing the postures. So there is no one, solution which fits everybody. We all are quite different. But if we are developing a certain postures and tightness and things like that, that's what we call as habituation. Some muscles only will be always used or overused, and most of them may not be used at all. So become aware of the wrong postures that we can get into, and the awareness itself will make us get out of that actually. That's the point that I just wanted to add on. And apart from that, ergonomics per se is not just the postures, it's the workstation adjustment. So the way ma'am was telling that multiple people are using it. So that's exactly the point. Before starting a procedure, I may have to fit that whole environment, everything according to my height, my weight, my anthropometry. And that's the key actually. So adjust your workstation so that you are not adjusting to whatever the workstation is. And that's ergonomics, basically. Thank you.
Thank you. Dr. Madhu, we will go to the next talk.
So, pardon me, sir. I think there is a power cut at Madhu sir's place. So I'll be just taking his place. It's my privilege to introduce Dr. Saravanan. Saravanan sir does not need any introduction, but since it's been given as a formality basis, I'm just telling him, a vast experienced surgeon, and he did his major education from Arvind, and he has visited n number of places outside as an observer, as a student. But now he has years of teaching. He will be enlightening us on the ergonomics of VR surgery, how to go about what are the do's and don'ts while doing a VR surgeon for all of us. Thank you, sir. Over to you, Saravanan sir, please.
Thank you, Rajesh. Thank you for the kind invitation. And can you see my slides now?
Yes, sir.
Yes,
We can see, sir.
yes,
Full screen, sir. Full screen. Yeah.
So this part of this already been covered by Pradeep, so I'll just skip these preliminary slides. So before we talk about the surgeon's positioning, I'd like to add a point on patient positioning as well, because lying down in a long surgery in a supine position is not always comfortable for elderly patient. So in cases people who are a little bit frail and not very comfortable, better to support their knees and their neck with a roll towel or some kind of props to make them comfortable for their long surgery. And also to get a proper view, what you call it as par focusing, the bottom part of the microscope, that and the eye plane should be equally horizontal to each other. This will give you a distortion-free view of all the peripheries. So you see that the all parts of the limbus, the 3, 9, 6, and 12 are more or less horizontal to the microscope viewing angle, so that you get a nice and distortion-free view throughout the surgery. So achieve this before you start cleaning and draping, because make sure that you give all the neck props and everything to make the patient comfortable in this particular portion, so that you need not make adjustments for the patient's malpositioning. So we'll go through some of the steps which we routinely follow in our OR. So normally some of the cataract surgeon scopes, we see that they don't have any armrest at the area where the patient's head rests. But for us, because we are doing long surgeries, having this wrist rest rather gives you to have a good support for strain-free long surgeries. And also the patient's position is usually, rather than keeping exactly straight, it is better to keep slightly tilted so that the operating eye becomes a little bit exo. It gives you much easier access to the temporal periphery, because the nose can sometimes obstruct, especially in a sunken globe or a long nose. It's better to keep the operating eye slightly exo by turning the patient's face towards the opposite sides. So make sure that you do all the proper adjustments which you are going to describe before you start your surgery, so that it's easier throughout, rather than making after sitting and starting then making the adjustments. So when you see here all the 3 axes of the main components, that's the patient's face, the microscope oculus, and the surgeon's sitting position, everything is more or less in a straight line, and the orientation is perpendicular to this single axis. Otherwise, they're going to have a lot of discomfort, especially when you're doing multiple cases sitting in that scope. So here you can see that the surgeon's face is straight, but the body is slightly turned to the left. Here you can see it's turned to the right. So this will be the more neutral position and more comfortable and strain-free position. So make sure that you do this before you start your surgery. The example of how the table should be, the table and the surgeon should be set up before you start your surgery. And as regards to the seat height, correct height should be approximately where your thigh and the leg is more or less at 90 degrees angle. This gives you the most comfortable position. If it is too low, you're having a unsupported lower thigh, and also your legs are cramped and gives you a little bit difficulty in mobilizing your foot pedal on the left and right. And if it's too high, then it's going to cause a lot of strain on the lower thigh. You can also have to little bit lean forwards, and that will create a lot of stress on the back muscles also. So make sure that your height is such that the leg and the thigh is more or less perpendicular to each other. This will give you the correct height. So you can show an example of a low height where the lower part of the thigh is unsupported and the knee is angled up, gives you a lot of cramping and also undue stress on your lower back. This is a little bit increased where you have to reach for your this thing, and also you may have to lean forwards when this is the case. And this is an example of a correct height where it is more or less perpendicular to the thighs, and the leg is more or less 90 degrees to each other. And as regards the foot pedal position, again, this is a lot of times missed because we change foot pedals for laser and all those things. So make sure that it is reachable and comfortable. If it is too far off, you'll have to stretch your legs out. And again, it's going to cause a lot of stress on your back. If it is too close, then it's going to again cramp your style, and you'll have a lot of stress at your ankle, which can cause pain in long surgeries. So that also you have to, and sometimes you have an inherent pressing of the pedal without your knowledge, because you are keeping your toe always elevated. So that is one thing. So make sure that your pedal also has the right position compared to your chair and sitting position. So this is an example of where the pedal is too forwards, and this is where it's too backwards, causing, you can see he's lifting the toe up to compensate for the closeness, and this is going to cause a lot of strain on the ankle and the toes. And this is more or less the correct position where it is more comfortable and more or less neutral. So when you have sometimes you have these different companies making foot pedals which can be a little bit higher and lower. So if you have one pedal which is lower, it's better to keep some sort of additional platform underneath so that it comes to the same height as the higher pedal. So this gives you a much more neutral position rather than working with the dissimilar pedals. Make sure that you have some sort of prop underneath to make it more or less equal in height on both the sides of your legs. And as regards to your back and neck, when the table should be as close as to possible. When you have too far, you have to lean forwards, which keeps a lot of stress on your back and neck. So make sure that your table is such that you have a sort of straight back position. again, which Pradeep was showing in his slit lamp examination and indirect ophthalmoscopy, so that it's much more. Here you can see example of where the surgeon is leaning forwards because the table is quite away from him, and this is more or less okay. So again, the table, when it's very high or when the chair is more low, it's more of a comparison. So if it is too high, your elbows are bent and it causes a lot of pressure on your ulnar nerves, which can sometimes produce some sort of tingling sensation if you're too much bent. And again, it's if it is too low, your arms are hanging down and your movements also become a little bit cramped. So make sure that you are at a sort of a neutral elbow position where you don't have to too low or too high, again, which gives you a lot of comfort of the shoulders as well. And also the elbow rest also is very should be properly arranged. So when you have a high table, your elbow does not rest on the armrest, again causing a lot of strain. And this is a low table where you can see the hands are cramped when you're trying to mobilize, and this should be the more or less the correct position for your surgery. And the microscope, like you see here, normally when you see cataracts operating, you see that the angulation of the microscope is more oriented towards his feet, 6 o'clock position. So this, I don't know why they do that, but for us, it is best to keep it as more or less perpendicular. In these cases, you see that they are elevating the chin of the patients to accommodate for this tilt. But for us, we have scopes which are having this mobile oculars apart from the main stem. So you can see that you try to keep it as perpendicular as possible, so that gives some easy focusing of the 12 o'clock position also. And the orientation of the ocular should be more or less parallel to the ground or horizontal to the ground, so that you have a more or less straight gaze. So this is a mal-aligned scope, which you see what normally cataract is doing with this. So you see that here it's more perpendicular, which to mobilize easier visibility of the 12 o'clock position, which is not possible when the scope is angled towards 6 o'clock. Some of the scopes have these markers to make sure that you are in the correct aligned position before you start your surgery. And this is how where you have the ocular should be more or less perpendicular. This is looking down and can cause unnecessary strain on your neck. This is looking up, again you have strain on your neck. This is sort of a neutral position where you're looking straight with the more or less straightly held neck and head. This is some example of a mal-aligned oculars. You can see he is having sort of a goose neck because of he's trying to look up because of the tilt, downward tilt of the oculars. And here it's upward tilt, and you can see that it's what you call a swan neck deformity. You can get that. And this is more or less where the orientation is correct with the horizontal looking head and neck. So this is how to sit. You can see that the elbow is propped well. The back is more or less straight. The oculars are looking straight, and the pedal and the seat height and the knee position, everything is more or less correct. As regards to the shoulders, when your armrest or the elbow rest of your chair is not at the correct thing, it can cause a lot of stress. So when it is too low, you have a drooping shoulders, which can cause strain. And when it's too high, it will cramp your mobility of your hands, again causing a little bit difficulty in surgery, especially if you're working towards the anterior retina or the anterior segment. So make sure that your elbow rest is more or less at the correct height to give a neutral shoulder position and more comfortable with less stress, either more stress or more cramping. So it should be more or less neutral to get this. So it's an example of a shrugging position because of the high elbow rest, or a drooping because of a low elbow rest. And this is more or less the correct or neutral shoulder position, and with the correct adjustment of the elbow rest height. So again, examples of how shrugging shoulders and drooping shoulders from the side angle to make you realize what are the difficulties when you have such position of the elbow. So as regards to your arm, choosing the gloves also is very important, because when during long surgeries, you can get severe stress in the wrists and in the palms especially. So there are a lot of studies to show that if you have a tighter, it gives you a lot of pain during the end of the surgery. If it is too loose or large, it gives you less tactile feedback. So the correct will be if you have to go for a correct fitting, so that you have less contractual force at your palm, so it will cause a lot of pain. So make sure that you have the correct glove. Don't go for either a small or a too large. Choose the correct glove, both for comfort as well as best tactile feedback. So one more thing which you see is beginning surgeons, they try to hold their breath when they are operating, especially on critical locations like the ILM or the ERM peeling. And this can sometimes cause a lot of stress on your whole body. So never try to hold your breath when you're operating on critical locations. So this is what can happen. You're putting too much stress. When you're holding your breath, your whole body becomes tense and stiff. So don't do that. Like how the teacher teaches in the Kung Fu Panda movie, breathing on and off slowly and smoothly is very critical to reach for your inner strength and maintain peace. This is an example of what we should be doing during our retina surgeries, especially when you're working in. Normally it happens because when you're trying to concentrate and you're especially when you're tensed, when you're operating on critical locations, you inadvertently, without realizing, hold your breath, which can put too much stress throughout your whole body, not only not adding to your mind as well. And the last, this slide, my colleagues wanted to put this. So for surgeons' well-being, not only working in the hospital, you have to chill out outside it also, so that you get free your mind, and that helps to loosen up your body also. So tensed or anxious or depressed patient can have a lot of difficulties and disabilities happening because of that. So not only inside the OR, but making sure that we chill out afterwards, also the critical part of the VR surgeon's well-being. I think I'll stop here. Thank you.
Thank you, sir. Wonderful illustrations. I think everybody agrees. Natarajan sir has already put it in description, that wonderful illustrations that you have marked out. Saravanan sir is known for it, and for his, in terms of cartoons being enlightening as also. Thank you, sir. Thank you very much. So, any other comments?
In the chill out image, he looks. The chill out image, he looks the fittest.
So,
and I think Saravanan, excellent illustration. I think a lot of lessons to learn from Kung Fu Panda. I think it's very good for a VR surgeon, for anybody actually. And I keep giving motivational talk to all the college students using the Kung Fu Panda. There are 11 lessons they are mentioned in the net. So I think it's a great thing for the VR surgeon. I mean, it's not only physical, you have to have physical, mental, everything, fitness for doing the surgery. So I actually bring the patient's head little forward. So almost the patient's head is like, I sit back like this and operate with the head on the head of the patient is on the lap. So that I don't have to do this.
Yes, sir. Yes, sir.
Wonderful presentation, Saravanan. Including the gloves, you have covered everything. Thank you.
Yeah. What Dr. Saravanan showed was the chair and table adjustment. In chair adjustment, it's very useful to have a very ergonomic chair, which has micro adjustments, which can be controlled by the foot of the surgeon, where you can, really put your back, arms, and everything at ease. These chairs come with a preloaded small battery, which is rechargeable and lasts the whole day as for your operating time. There is a price to them, but they really make the task, the micro adjustment, really give you the peace of mind and relaxation to your back and neck, because you're really able to reach the optimum height and where you're totally relaxed for surgery. Thank you.
Thank you. Thank you, sir.
Can I ask a question to Saravanan?
Yes, sir. Muralidhar, sir.
Yeah. I wanted to ask Saravanan, what do you do when you have to wear two gloves? Now, my size is 7.5 normally, so I wear 7.5 and 7.5 again over that, because that we need to do often whenever we're operating on it.
Better is to go for gloves to be slightly larger than the first gloves. That will give you more comfort.
No, I actually using from 91 when I started doing HIV patients, I wear 8 gloves and then over there 7.5.
Tighter.
And I think it's okay. I also developed the tactile sensation with the 2 gloves. And as Saravanan said, you have to be comfortable. So I'm very comfortable having the what do you call the drape, the dress still here, and then it's covered totally. I mean, you have to have flexibility and I think no stress on the hands. I always wear double glove, so that if there's one problem in the other one, and I've developed doing everything with that. And another thing is, I think Alcon has done, or any other company, no financial interest, all instruments should be light-weighted, like the 5 grams or less. Any instrument, and every instrument, hold it like a pen so that you don't have the wrists. So that's why exercise is important, I mean, to tone your muscles.
Dr. Muna wants to make a comment.
Yeah, Saravanan, that was a brilliant talk, and especially the Despicable Me scene, I remember it so well. Yeah, I think more than holding the breath, all of us unconsciously tighten our neck muscles when we are doing step. Not only a junior surgeon, I think it happens to all of us at some time, and that's something we need to consciously look for. And also, people who are little large and bulky and obese, when they try to put their legs under the table, sometimes their thighs causes a problem. So I think that also is something that needs to be, your cartoons and all your models were very average size. So they look very fit. I was just thinking of that because, it's the build of the person also that sometimes we need to take into account. But thoroughly enjoyed your talk. Thank you so much.
Thank you.
Just
you want to say something?
Yeah, I just wanted to make a comment that most of us are having fellows, and we are sitting on the side.
There is an
But
echo
when you're
from
sitting
your
on the
Dr.
side
Murthy.
also, you have to
I
adjust
think he
your
has logged
height
into two
properly.
accounts. That's why it's happening. So I think you're logged into two accounts.
There's an echo when you speak, Dr. Murthy.
We're not able to discern your.
Okay. Oh, sorry. I think I had logged in two devices. No, when many of us are having fellows, and when fellows operate, we are sitting on the assistant's course aside and then observing and guiding them. And that time also, it's important to maintain at least your neck and shoulder position properly. And then when you change and take over the surgery after the initial part, normally what happens is we take over some critical steps, and therefore we might not kind of adjust the oculars back to the height of our height. So when you're changing over, always make sure that you adjust the microscope properly, whether you're on the assistant side or on the surgeon side. You make sure that you adjust the height, and this one has Saravanan as so elegantly given his lecture. So it's important, when you're switching over also, please make sure that you do these adjustments, and also teach your fellows right in the beginning. Many times fellows are a little reluctant to ask the OT people to do the adjustments because they feel a little intimidated by our presence. So make sure that the fellows also are taught the proper ergonomics and the position of the head, even when they are assisting, because they have to be sitting in the assistant position for such a long time. And they also should follow these and make sure that they follow these in your day-to-day OT. That's something I wanted to just highlight.
Dr. Arun, sir, you want to say something?
Yeah, no, two things I forgot. One is I also made our surgeon's chair a scooter chair. That means it becomes like that so that the sciatic nerves are not pressed. The other one mentioned, Saravanan mentioned about the breathing. One more thing, I think there is a publication on people don't blink while doing the ILM, feeling they're continuously staring. And that also adds to your actually stress. So the breathing plus the blinking, I think you have to learn to relax totally. So I have music both for the patient, and now I changed to chanting for both for the patient and me. Very rarely some patient will object, but 99.99% I think the music helps you to relax.
Mahesh, one thing I wanted to stress again is the relaxation in between cases or during cases, just stressing what Dr. Saril mentioned on the prolonged procedures, just stretching your neck off, moving it and then rotating the head and all that helps. Even lifting your hand if possible or stretching your hand does help in a way, because invariably while you're doing certain procedures, you can't relax when you're, as Saravanan pointed out, if we could relax during ERM peeling or something like that, it doesn't happen so often. So you really are focused and concentrating, straining your muscles, doing things. So it will definitely help a lot is to stretch your muscles whenever possible, especially in between cases, doing exercise like bending down or sitting, squatting, or getting up. All that helps a lot in relaxing your overall muscles. The Dr. Dam, he used to do buckles continuously, and then between every case, he used to do these exercise. Even today, at the age of 85, he's able to, he can easily perform any of these procedures. So that's a real lesson to maintain your back and the rest of the muscles properly, especially during these long procedures.
Correct, Dr. Tim. I think Shweta and Dr. Saril will cover part of it during their lectures as well. I think so.
Mahesh, only one more point is other thing I learned, particularly Dr. Charles Gibbons, when he visited my OT in '93. One is he said the surgeon should have a flat abdomen, that means strong abdomen. And he told me this bed will be painful for a patient, and he lied on the patient table and told me, how can I lie down for long? You're operating for maybe under, I told him that time it was all GA. This is patient, no, but you don't know. Have you ever gone to the post-operative ward and asked how much is your body pain because you're lying down under GA also? So I think that time I realized I put such a big cushion for the patient, separate headrest and separate so that when you sit, there's some cushion effect like a sofa, and it's firm like an orthopedic bed.
Thank you, sir. I think we have had wonderful discussions on this first session. Dr. Saril, you want to add anything?
Because I totally agree with all those. There's a lot of learning coming in. Thank you.
I just want one point, looking at what Sir started with, having the patient's position as the first, even to keep advising us always to look at the patient's position first. We had a heart in a mouth on the other day when the patient had renal failure, but he was not willing for dialysis, but he couldn't maintain a proper a supine position for more than 10 minutes. And it was a diabetic CRD, and it was a hell of a time by the time we finished up. So yes, and second thing is, as he rightly pointed out, one is the patient's, but if the patient's position cannot be at the optimal because of whatever reason, we have to have a back and neck strengthened so that we can cope up with that surgical intervention.
Thank you, Rajesh. I think we'll go on to the next part of the session. And Dr. Rajesh has worked with Shweta as well as Dr. Saril to put up a wonderful presentations, I guess. So Dr. Rajesh, please take over for the next part of the talks.
Thank you, sir. I have a unique session to moderate, and I'm really thrilled with it. And I have an equally more competent, expertise with me. And let me brief through what they're going to cover up. So what we had right now is a primary prevention. What I mean by primary prevention, you do a certain things, you prevent a disability from arising. So that's the primary prevention, which Pradeep and Saravanan sir have very elegantly covered. Now we are going to something much beyond it. So we are going to something was primordial prevention, where Dr. Saril, who is an ergonomic and robotic rehabilitation specialist, I was so enlightened to have so many specialists are there, and he has gone beyond, designing the way we have to sit and think. We hadn't heard of it at all. So really happy and privileged to have you here, sir. So he's the director of cardiopulmonary rehabilitation at Sakara World Hospital. So sir will be speaking about strengthening the back muscles and muscles of the back and neck. So over to you, Saril, sir.
Am I audible?
Yes, sir.
Yeah, you're,
yes, sir.
You're audible. Except that your PowerPoint is not showing. Maybe you have to open the PowerPoint and then share. Now we'll see. Now we'll see.
Yeah, all right.
Yeah, fine.
Thank you. So welcome all. It's a great platform. I'm so happy and thrilled to be here. We've been working with so many different types of professionals, and including working and taking care of physiotherapists and my other colleagues as well. And today this is a very unique opportunity, and I think there's so much that we can do, and I am feeling so much empowered because of the knowledge, and more than that, the opportunities that lies ahead. I think it's my responsibility. Somewhere I feel that we never thought of. We have worked a lot with the dentists and a lot of other surgeons as well, but I think it's so obvious. Somewhere I feel regretful that we never kind of looked into this particular segment where it all becomes so meaningful. Now, as Dr. Rajesh said, let's quickly get into what we can do because these stress and strain is going to be there. This is our profession. All that we can do is to brace ourselves and strengthen ourselves. And when I'm going to talk about neck and back exercises, I'll be slightly modifying the topic to just exercise as medicine. We call all these problems which arise out of work as work-related musculoskeletal disorders, WRMSDs, or there are many other names for it actually. RSI, repeated stress injury. So a few of the points that we need to understand over here is it is not habitual, the habits rather of repetition, putting more stress, getting more tense when I'm doing something, a lot to do with the person itself. But these are an overview of what OEM doesn't teach us, what and how all these adjustments need to be done. So adjusting, arranging your workplace so that we are not adjusting our own, or we are not compromising our own body comfort and the postures. Psychological stress is a huge element, and that puts, as man was telling, that the muscles automatically start taking up to a higher tensed tone, and that continues throughout, and the person starts developing it as a habit. Exercise frequency, this is nothing but our physical activity or a habit of doing the exercise very often, or just movement. The spinal mobility is an extremely important aspect, because a surgeon who start sitting for 3 hours, 4 hours, 6 hours on a routine basis, what happens is the spinal facet joints start getting locked. There are smaller ligaments, and apart from the muscles, which actually shorten over a period of time. All this eventually gets into a locked up position, and that's what is called a spinal mobility. Nowadays, we do have chiropractors in Bangalore who are more specialized in unlocking these joint problems to get you a more beautiful movement and prolonged, sustained posture. This need to be overstressed throughout this presentation, because it's every word is important. Prolonged, it's the time. Sustained, you just stay onto the same posture for too long and you don't change the posture. Now, because of all these risk factors, what we are seeing here is these major muscles, ligaments, the bone and the joint, they all get to take a lot of stress. The mobility reduces. And eventually what you can see over here is something what we call as fascia. Now, this is the most important aspect nowadays. The entire science is focusing on something we call as the myofascial tensions. The entire body beneath our skin has this facial covering. And if fascia gets tight, that's why sometimes we wake up with a tight area around the neck, and it's so painful. We start calling those nodules kind of a thing called a trigger point, or a myofascial pain syndrome and things. So all these red dots are the most prominent ones that could get. So they could be active trigger points, and they could be latent trigger points, which develops in each of us. And the more experience that you get and our age progresses, our defensive mechanisms start weakening, because we become less physically active. And therefore, the entire focus, I would like to shift on to movement as medicine. So we are going to cover up majorly the postural awareness exercises. There are a lot of techniques that we can train a person to become very mindful about the body alignments, like how, as the first presenter said, how much the head is tilted forward. So even if you are closing your eyes, how do you get to feel where is your body positions aligned in relation with each other? So this is a sequential exercise that we teach, something we call as Alexander technique. And there are many other techniques which are more popular. But eventually what we do is, it's like using Legos that you build a person's body. So where is your hip? How is your knee? How much is it bent in relation to the right, to the left? So the entire body, we allow a person to scan yourself. So, and do this so often that you start developing a sense of your posture, and wherever you feel stress, you start relieving the stress. Relaxation exercise is extremely important, and I'll be happy that my the next presenter on yoga therapy would be touching a little bit on more of the breathing exercises that could be done. So there are something called progressive relaxation exercises where you can just clench your fist, for example, for a few seconds and then relax. But what we do is we progress this upwards. Then it becomes the forearm, then becomes your elbow, then becomes your shoulder muscles. So you do it one after the other or both the sides together. It's up to us. But eventually we learn to relax. We have had so many, my own colleagues from the hospital who come after a few days of stressful surgeries. And even if we make them lie down, they just cannot relax, or some parts of the body still continue to be in the tensed position. Therefore, breathing exercises, it could be as simple as a mindful deep breathing. We could take a deep breath through the nose in and breathe out through the mouth. If we want, we could count it. Say usually what we prescribe is like inhale for a count of 4, hold the breath for a count of 4, and exhale for a prolonged count of 6, and then hold the exhaled position for a count of 2. When I say count, it can be at the pace that the person is comfortable with. So that's about the relaxation exercises. And what I will be taking you through a lot of videos today is the stretching exercises, and which we can do in between the work. And that's the most important part. We don't do exercise only in the gym. We do it in our workstation in between our work. And strengthening exercises. So this is the ultimate warrior, which would literally, safeguard us against all the future stress and strain that's going to come up. And last but not the least, the most important thing is do anything which is physically active. So just do not get into more and more of some kind of posture, some kind of positions, and feeling so comfortable that you're always in your seated position. So try to be as active as possible and get into a more physically active lifestyle. So that's how we call it as movement becomes a medicine. The only catch over here is all of us are different. So we call this as anthropometry, which is nothing but maybe even for the same person, my right side and left side is sometimes asymmetrical. So the length of my hand, the length of my legs, the length of my limbs, everything. So we are all so different. And therefore, so that's the anatomical variation. And so becomes more relevant over here is the biomechanics of our own body varies so much. It's the way that some part of our myofascial part is more tight, maybe some muscles are more tensed, maybe certain joints are locked and they don't allow it to be the full movement, all that we call as the biomechanics. So we need to really have an understanding about how well your body is active at this moment, based on which you adjust all these exercises. So it's not necessary that every exercise that we are going to show is going to work out for somebody. What I mean to say is, if you don't have a tightness in a particular muscle, you will find that exercise very easy. So you need not focus more on that. So we are all different. So one size doesn't fit all. So is the exercise over here. Let's look a little deep dive into the stretching exercise. And that's the majority of the program about. The stretching exercises are such amazing one where it improves the range of motion of every single joint. So the illustration that is right below, if you all of us just try, to touch our hands behind, and then you will be so surprised if you turn these sides to the other way, there will be variation. So that is a very simple indication of the asymmetry in our body in terms of movement. Stretching exercises helps us to relieve tension in tight muscles. It improves the circulation to that local area as well as the entire joint. It prevents stiffness from prolonged sustained positions. But these are the key points. Slow, extremely slow, sustain a stretch, be as relaxed as possible, do not use any accessory muscles, be completely mindful about what you're doing, have a relaxed breathing, and repeat it at least 3 or 4 or 5 times. And usually we say up to 20 to 30 seconds of a hold of a particular stretch is always good, so that we're giving enough time for the sarcomeres and everything to really relax. And the body start understanding that I need to lengthen this muscle over a period of time. I would be happy if anybody would want to perform it along with the videos. The first and the most important that we are going to do over here is called a chin tuck. Very simple exercise where what we do is we are going to just take our chin backwards. If needed, you can use the hand like the model that is doing actually to just hold the position. What we're doing is the ear is becoming aligned in your shoulder level. And these, especially the C1, C2, the joints over there, it's very difficult to mobilize those joints. And those are the problem areas if you're continuously bending down and focusing on something, especially when the weight is more forward. So this is one exercise to reverse the impact, the negative impact of all that we have been seeing so far. Very important and very useful. So we call it as just the chin tuck. So just forward, you'll be able to take it forward and you can take it backward. Without rest of the body part is totally relaxed. And similarly, the second important thing is a tummy tuck. It may not be so visible in the video, but what you can do is just go stand against a wall, align your head, touch the wall backwards, your shoulders relaxed and rounded onto the backwards, and your tummy, you just pull it inside, but you continue normal breathing. Do not hold your breath over there. Continue doing normal breathing, but what we are doing is over here, your tummy tucks. Now, once we learn it in this particular pattern, we could do this in any position, even while driving, even while talking to somebody, even while doing your surgery. You just can learn to tighten the tummy muscles and you still be breathing. It takes a little bit of practice, and maybe in the beginning, you might need somebody to really observe at you. Or if you are more mindful, you could hold your hand on the stomach muscles to feel the stomach muscles getting a little tight and hold the posture. Now you can see that what we are doing is we are aligning the head to the shoulder, to the hip, to the foot. So everything, all the joints become in a particular line, straight line downwards. And there, if you are feeling too tightness or too difficult to do something, those are the points that we need to focus further. Neck forward bends. Very simple thing, though we are always sitting on that. What happens is every joint, every movement need to be taken to the extreme. So we usually do not have any movement where I have to completely let my chin touch my chest, if possible. And forward neck bends and the reverse of that. And this is a brilliant one. If you just start doing it very comfortably, take the head backwards, as far backwards as possible. But mind it, I'm not bending completely backwards. It's only my neck which goes completely backwards, and hold over there. If you will, you could close the eyes and do it and feel the entire movement and feel the stretch which is happening in front part of the body. Moving forward, neck side bends, and very useful exercise that you will find. And in this particular video, as you can see, the person is holding on to the chair so that there is no accessory. So one end of the muscle is stabilized, and the other part you slowly stretch as far you could, and then use the hand to stretch still further. And the trunk remains straight, but the neck is bent to one side. And please remember, once you do this, do it very slowly, come back to the neutral position, repeat 2-3 times. If you want, you could repeat more than that. The more, the better. And then please remember to balance it by doing it onto the opposite side as well. So the next side bends. Shoulder shrugs. Simply lift your shoulders to your ears as far as possible. If you want, you could just hold it as high as possible and then totally let it go. Relax as far as possible. You may retract also. This kind of, take it completely up and fully down. And shoulder rotations. So beautifully, just try to rotate, like make circles in the air and forward, and then you reverse the entire direction backwards. And with this regard, what I want to tell is the scapula or the shoulder blades, that's what we need to work more. Pectoral stretches, and I was very surprised to see the beautiful video in the very beginning, and thanks to the brilliant work that is done by your entire team, Dr. Mahesh, that the wall stretches that you do. So this is a unilateral one. This is for your front pectoral muscles that you just hold onto any surface and then you try to reverse onto the opposite side. You all could try it once wherever you are seated. So very simple stretches, and then try to do it on the other side. Even if you're not holding anything, it's still fine. You want to hold behind something, a table nearby, and you just stabilize the end portion, and then you turn as far backwards as possible. So the entire front shoulder portion starts getting relaxed. And if you want to do it for both the pectorals, that's when you do something onto the corner of the wall, the way the model was doing it particularly inside the lift. So you can just simply just extend your arms and stretch as far backwards as possible, and then you move forward. But the advantage of holding on to one side is one end of the muscle is kind of stabilized, and then you can very slowly, you will know that you're progressing day by day. Shoulder stretches, further to that is that the scapular muscles, what you do is we make a fist, and we bend down a little bit. And here, what is not really visible over here is that you need to move your shoulder still further so that your scapular muscles start stretching bilaterally. That's the very important thing. What we call as periscapular muscle strengthening, stretching is the key. And this, you are doing it for the horizontal abduction. And this may or may not be a problem. Many people do that very often. But the point here is, some of this might look very simple, but knowledge translating into practice, remembering to do it in between your work. There is no particular order. You can pick up any of these exercises, but get the habit of breaking your work in between and do these things. You may do it as a preparatory in the start of the day. You may do it as a cool down also. You may do it in between, or may you do it when you get back to your OPD. Anywhere, just get the habit that you're aware that all these muscles are getting stressed throughout the day. So you need to unwind it in between. Before it starts piling up, then you go back home. So don't wait till evening. Start doing it during the day. This might be a little more difficult, but very effective, excellent. I mean, this is something that those particularly purposely I put this one because I'm sure when you start showing this to youngsters, they will find a lot of these exercises. Oh, this is very easy. This is very easy. So try giving a little more, difficult ones where the entire body is participating and your entire front chest area, your shoulder capsule, all of them get to stretch, and you are doing a good amount of exercise to the entire body. So it's a whole body stretch. It's a very simple triceps muscle. So you could do it, lift up and push it backwards beyond, and remember to do it on the other side as well. Similarly, if you want to do it in a little different way. So why I'm showing these differences is, as I go back to that slide, that one size doesn't fit all. Some of these things we might find it very easy, but we will just vary a little bit. We know that, okay, because these muscles have got different fibers, and it's not necessary the entire muscle is always tight. Maybe certain muscle fibers are more tight than the other fibers of the same muscle may be a little loose. So try doing these different variations so it becomes easy for you to understand which one is problematic for you and focus on that. Very important aspect is how you do exercise for your hands. And this is just for the distal IP, interphalangeal joints, the first exercise. The second one is for the, as you can see, the proximal IPs, where the MCP is remaining, the metacarpophalangeal joint is remaining straight, and then you're only focusing onto that. So this is for the MCP. Very simple exercise where you are just lifting it. So these are simple ones, but how it becomes useful is when you do it and how often you do it. This is for the entire hand to clench and then just spread as far as possible, because a lot of lumbrical muscles inside the small muscles, they get tired very quickly. So please remember to do these stretches in between. This is for the radial and ulnar deviations, actually. So you can just keep it next to that. And these are the ideal positions that I'm showing, but please do not think at any point that there is a particular way that you have to do it. Any movement is good, trust me. That's what my entire experience is taught me. And this is for the pronation and supination. So you can just get your whole hands together and then just turn it. Please know that in this movement are a little faster, but if you feel tightness, please stretch and hold it for longer. Please do not do it so quick, because if the muscles are tight and if you do it very quick, it'll get more tight. So we have to be very careful. We are trying to relax and relieve the muscle tension. So therefore, the movements need to be prolonged and very gradual. Now, let's think about the trunk. So forward spinal stretch, where your legs are a little wide apart. And then the point here is, now, please do not get confused that, when we have been telling, do not sit forward the whole time. And now we are trying to stretch it, because we do not get to this extreme of the movement. Therefore, it's very important that we take the body to the extreme range possible for each of us, and the reverse of that. Brilliant one. If you have been sitting and doing the surgery for a very long time, all you have to do is this one simple exercise will do its magic. You just have to stand, stretch as far as possible. And when I'm saying as far as possible is a very important thing. We should know where is our limit. We should not be overdoing it. That's when we get a lot of patients coming to us, but I did the exercise and landed up in this pain. Lateral trunk stretch, which is nothing but to the sides, to both the sides that you can. So you may do this in sitting as well, where to the sides of the chair that you go, or still better, because you're continuously sitting, you can stand up and stretch. To change the posture itself is an exercise. Wall slides, there's a little advanced exercise, but if you have started feeling the pain, please get into a little more difficult kind of exercise. So there are different grades of exercise that we need to know which one fits for each of us.
Oh, sorry, I'm interrupting. We need to quicken a little bit, sir, because we're running a little bit short of time, sir. Sure. Sorry for that, sir.
No problem. This is knee to chest stretch and quadricep stretch, where the leg is taken backwards, and a calf stretch, which can be done right on top of your chair. So what I'm trying to carefully pick for us, this particular, professional group, is that all this is possible right in your workstation. And nothing, something that we overlook is, like as ophthalmologists, the most favorite part of mine is exercise, because I'm sure I don't have to tell you all that there are smaller, finer muscles for the eyes, and they need to be exercised. And I would leave up to this group to figure out. I'm sure you are the ones who prescribe eye exercise to all the people. So there are around 6-7 different exercises that we can do we are refocusing, and we sometimes blink, or you can do palming, where you just totally close your eyes and open your eyes into the darkness and then take it out, because there's a lot of light coming into the eyes. So eye exercises are equally important. Moving on to the strengthening exercises, this is to improve the posture, circulation, and endurance. Endurance means the ability to hold it for longer time. We could use isometric neck rotations, scapula stabilization exercises, postural retraining, deep neck flexors activation and training, resistance band. Nowadays you get it, the colorful resistance bands, or dumbbells. They are enough for us to do various exercises where we can progress it over a period of time, add more resistance to the exercise and do it. So in nutshell, it's at least 20 minutes strength training program, 3 times a week for 10 weeks is scientifically proven to reduce neck pain, and brace yourself to take care of yourself and face the daily stress and strain on the body. And eventually, the last but not the point is a healthy lifestyle. Walking, cycling, dancing, swimming, any recreational sports. Doesn't matter even if it's only on a Saturday or only on a Sunday, it's okay, but anything is better than being sedentary in your lifestyle. So physical activity conditioning is to have a basic level of body conditioning and ongoing. And if you get a pain, is where we could really help you. There are manual therapy techniques, as you can see over here, where we use commonly what we call as trigger point therapy. Nowadays, we can teach a person to do it themselves. Dry needling, foam rolling. There are laser therapy, RPWs, kinesiotaping, as you can see over here, or a dynamic taping. And this is an important aspect that I would like to highlight on, because this is something that we have developed with a lot of research ongoing, that we can do a complete ergonomic wellness screening. I'm sure all of us are aware about health checkup, but now we have developed a specific ergonomic wellness screening for everybody, which covers, we will have measurements for each person's flexibility, posture score, spinal mobility, core muscle strength, endurance and balance score, respiratory muscle strength, functional capacity evaluation, which tells that how much each surgeon can perform, and functional movement screening. What are the limitations in the body and what need to be focused on? So this is a very advanced thing, and I'll be extremely happy. I've already shared this idea I was planning to do with Dr. Mahesh as well, that we could all join hands, and we'll be very happy to do it with as probably a study or something like that for anyone who is interested in this group. And we could really profile you out. Like we all know our sugar level, we all know our cholesterol level. Similar way, now we can get all these elements measured to the numbers, and then we can give you a customized training protocol. This is not available anywhere in India, but we have developed it, and all the tools are available. And we could do this in your hospital. The whole team can come over there. We just have to plan it out how to do it. And we call it as ergonomic wellness screening. To sum it all up, we are evolving, but are we really evolving to the level that we should meet our daily stress and strain? Thank you.
Thank you, sir. Wonderful exercises and presentation. Only thing is, like, we need to keep these things at our mind. I will coordinate with you for some kind of a ready reckoner, which we might have. I'll call upon my next speaker because it's a bit of overlapping. So Shweta is our own fellow, though we call it as a student, but she has an astute yoga practitioner and has many awards to our credit. So without wasting much time, I'll ask her to start her topic on yoga. And once she finishes this, let us come to a discussion part of it. So thank you.
Thank you. Good morning, everyone. Thank you for having me here. I don't know if I deserve to be in such a big panel of big speakers, but I'll try to give my best here. So I've just put up these pictures here to show that these are two faces of me. Both are equally important to me. And the second one has actually helped take the first one forward without putting me into much of pain. So let's see what we can come out of this presentation. So to begin with, many of you might be thinking yoga is like complex asanas, many difficult postures. Not really. It's not just an exercise regimen. It's a way of life. You have to inculcate it in your life. Not just I've put this picture because Mahesh showed one contorted picture of me. I prefer to do such light poses also, which helps us in mindful breathing. And living with discipline is important because whatever exercises that we learn have to be done on a routine basis every day, very strictly and stringently, without compromising on the compliance. That is very important. So regular practice of yoga has a huge impact on physical, mental, and emotional well-being. So how does it help a VR surgeon? Firstly, there are three aspects that we'll be seeing in this presentation. First is the primary prevention. And yoga actually helps to get the postures right. All of the previous speakers have told you how important having a right posture is for a VR surgeon. So a person who is practicing yoga for years by default will have a good posture, and that kind of reduces their chance of having a bad experience or an injury. Secondary prevention, if you develop an issue, then how to fix it then and there before they actually lead to serious problems later on. And if you happen to develop a serious problem, then how to recover out of it and how to treat it. Treating the aches, pains, injuries, and spasms that are associated with the tedious VR surgeon routines. So primary prevention. So how to get your posture right. So thanks to my friends here who have volunteered to give these photographs for me. So this is how many people would be examining patients. But here, this is not a mock picture. This is how I sit. By default, I try to sit straight. So it helps in, you can observe here in most of these pictures, the surgeon's seat, I mean the doctor's seat is at a higher level than the patient's seat. And the doctor is bending forward or stooping forward in some way or the other. But here in my case, I have kept it at an optimal level. The seat is a little bit lower than the patient's seat and I'm sitting straight. So maintaining an erect posture throughout the day is very important, and it comes habitually if you're doing yoga on a regular basis. So here I'll show you few exercises that can help you keep your postures right. So this can be done using any stool or any resistance band or whatever you have. Sorry for that. Okay. So keep it as far apart, wide as you want, showing from the front first, and then I show from the side as well. Take your shoulders around. Shoulder rotation has to happen without bending the elbows. This may look very easy for some people, very difficult for some people, but trust me, once you start doing this, you start feeling the relaxed feeling here. As you progress forward, you can reduce the distance between the two hands. As the distance reduces, the difficulty level increases. So for beginners, you can keep it wide apart and do it. It still works, and you will start seeing the difference. It will relax the neck muscles and the shoulder because those are connected. So it really helps. This is the first one. Second one is something that is called the cat and cow pose, very popularly practiced across. So this is the cat pose. You have to notice 2-3 things here. Firstly, the thighs and my hands both are perpendicular to the floor, and I am making sure that whenever I bend forward, my neck is all in one curve, and here it's on the reverse curve. So when I bend forward, the breathing is out, and when I bend back, it is breathe in. So if you can keep the breathing in alignment with the movements that you do, then it is even more helpful. So we'll move to the secondary prevention. What exercises can we practice regularly day to day with less time that is available for us? And what can we do between cases to stretch out and relax those tense muscles? So few of these already Saril sir has shown. Let's just run through this. I'm standing shoulder distance apart. My legs are shoulder distance apart. And I'm doing the neck rotations, neck movements that sir already showed. Like he said, we are taking the neck to the extreme range of its mobility, back as much as possible, and front, the chin touching the chest, and side movements. You can notice that my shoulders are straight. I'm not lifting my shoulder to get my shoulder to touch my ear. Rather, I'm trying to bend my neck as much as possible to touch the shoulders. And then gentle neck rotation. You can do all this with eyes closed. But if you are a person who is prone to get vertigo, then keep your eyes open when you're doing the neck rotation. This video may look a little fast. For the purpose of time, I've speeded it a bit. But while you're doing, take it slow. Understand that each body is different. So you'll have to treat it differently. So the next one that we can do in between cases, stand again shoulder width apart. Then I first show what could be done wrong. Many people do this, bending the knees to go back. The intention is not to bend more. The intention is to stretch the spine more. Whatever is your range, reach only up till there. It's okay if you can only do this, or you can do this, whatever is possible for you. But at any point, the legs should be straight. You can notice that even on bending that much, my legs are straight. The whole purpose is to put no strain on the legs, but rather stretch the spine as much as possible. And in yoga, we always do counter movements for any movements that we do. So when I bend back, I have to bend forward to balance it out. So even in the OT, when you bend back, you can do a front bending movement so as to smoothen it out. So again, the point here to remember is when you're bending back, you have to inhale. And when you're bending forward, you exhale. In yoga, the breathing and movements have to sync. That is when you get the maximum benefit out of it. So I just try to put up pictures to understand what, which areas you're targeting. So when you're doing the back bending, that is called the Ardha Chakrasana, you're targeting the latissimus dorsi and the trapezius muscles. And when you're bending forward, again, the spinal muscles here along with the hamstrings. So your leg muscles as well as the back muscles are taken care of. So another one, this may not be possible in the OT. You can do this in standing posture also, but this is something that you can do as a routine, a daily exercise. You can add it in your daily exercise routine. Sit in whatever posture is comfortable to you and try to twist your spine to whatever extent that is possible. It will help in elongating the spine and helps you give a better posture, as well relax, ease out the tension that is in the spine. So the same thing I'm doing on the other side. Try to look as much back as possible. And if you are flexible enough, you can take it all the way around. You can see my left hand coming forward and I'm putting it on the right thigh. There's one other thing also in this video, which okay, after this. So we'll do another posture, a front bending posture. Sorry, side bending. Here, Sir showed the similar one in an animation. The side movements, he also told it can be done in sitting position. That's what we're doing here. We're trying to stretch the side muscles. To increase the range of motion, I have moved on to my elbow on the left side, or you can keep it like this if it's not possible. Same, breathe in, bend, back, bend, breathe. Have a slow breathing happening there when you're at that position, and then come back. So here, okay, this posture is not exactly what we did. We did not concentrate on the legs there. I wanted to keep it simple. But notice here that the latissimus dorsi, intercostal muscles, external oblique are all being put to use. And here, the next posture that we'll be seeing has this muscles also being used. So now we'll do some back bending. So I'm in a prone position here. Don't get intimidated by the amount of bending I do in the first go, but I'll again show variants of it where different levels of bending can be done to make it suit yourself as per your need and as per your condition. So do small repeated sittings of this. Try doing multiple repetitions. Breathe in and go back and slowly exhale in that position. So here you can see I'm not bent as much. So that's how it goes. So if you bend as much as I did in the first one, then you're targeting the infraspinatus and the spinal extensor as well. But if not, you can still only do this much and still get maximum benefits out of it. Next, we'll do some relaxation. So we bend forward in whatever sitting posture is comfortable for you. Try to bend slowly and relax there. Here, if you cannot do what I'm doing, then you can take a pillow, a prop, anything that can help you bend without having much flexibility. This will kind of relax this posture. You have to keep the breathing on, slow and calm. This is a relaxing posture called as Shishuvasana or Balasana. That is the child's pose. That is how the child is relaxing inside the mother's womb. That's what they say. And now we see another posture here, a forward bending posture. See, I'm trying to show different levels here. See, you may be at any of these levels, but in the end, you will still get the benefits. You may not be able to complete the posture. Like they say, the journey is more important than the destination. So even if you cannot reach the final posture, try and attempt as much as you can so that in the process of trying to bend, you will still get benefits. If the final posture is not possible for you, again, you can use a pillow under your knees so you can do it in a easier way. Okay, so even this much bending is also okay. Try to straighten your back and you will feel the stretch more. So like I showed, the fetal pose, relaxing pose, and we top it off with Shavasana. Yoga always ends with Shavasana. So you may not have time to do everything, but never end your yoga session without Shavasana, because after all that metabolism that has happened in the body, after increased blood flow to all organs, you want it to come to an equilibrium. So to achieve that, at least a minute of Shavasana is definitely essential. So that's what I'm doing here. Let us not forget our assistants, because as much as we toil in the OT, they toil harder to make your case go smoothly. So we have to take care of them also. They also have a neck, they also have a back, they'll also have aches. But one additional thing they have here is that you can notice that the sisters are mostly standing while assisting. So they also have this additional leg pain, hip pain that will come due to long standing, doing this work for years together on a day-to-day basis. So apart from the exercises that I already told in the past slides, we'll teach them some asanas, some exercises which can help ease their leg pains. The blood supply to the lower limbs is greatly reduced, or rather, I'm telling Uta, sorry. The blood supply is all pulled down in the lower limbs. So they might develop varicose veins and problems like that, pain in the legs. So you can ask them to do simple postures like this, which will help in having a good venous return. The soleus muscle will pump. You can ask them to keep moving their limbs while assisting, just to keep the soleus pump activated. Or simple exercises like these can be done at home. If this is not possible, you can take the help of a wall assisted leg extension can be done. So that way, with the legs being supported, the blood supply from the lower limbs back into the center can be stimulated. Coming to the therapeutic part of it, what is so special about yoga therapy? So here, commonly there is no immobilization, and whenever we have a pain somewhere, many normal systems of medicine will stress on immobilization. But in yoga, we don't immobilize those joints. We start them on gentle mobilization, under monitoring, under guidance. We don't push them to the entire range of their flexibility in this case, but try to get back the range of motion in a graded way. So then we have to strengthen those muscles which are in pain, which are, they have gone into some problem because they are not strong. So you have to strengthen it also. That is also done. And try to stabilize those joints. And then gentle stimulation, sustained relaxation. This is the whole mantra of yoga therapy. So wherever is the ache, first we'll have to identify what is the problem. Many a times we may have a pain in the neck, we may have a pain in the back, but the cause may be somewhere else. Like when you're operating, your neck is not doing much, it's just sitting straight. But if your shoulder position is not proper, it can cause a pain in the neck. So it's opposite to the radiating pain that we talk about. If you have a central cause causing a peripheral pain, it is the radiating neurological kind of pain. But there can be the other way also, where the periphery is having a problem. So you're trying to compensate for it by changing the axial system of the body. So we will have to figure out where exactly the problem is, try to localize it and strengthen all the joints around, not just that joint. So if you go to a yoga therapist with a neck pain, he'll not straight away ask you to do neck exercises. He'll first ask you to start with the fingers, then hands, then the forearms, arms, shoulders. Only then after, you get the idea that these joints and muscles are kind of stimulated, the blood supply has set in, only then you go to the problem areas. So many people keep asking me, being a doctor, being a person of science, how can you propagate alternative therapies like this, yoga and all this is bullshit. There are people who have told me this. No, being a person of science, I vouch for it because there has been solid research to support use of yoga therapy itself or as an adjunct to modern medicine to help in backache, neck and all that. There are meta-analysis done, systematic reviews done. So this is not just goof up. There is solid evidence for this. So let's trust in the system. And one important reminder, yoga is not instant remedy for anything. There are people who come to me and tell, I have this problem, tell me one asana which will cure everything. It doesn't work like that. So you have to have patience here. That's the important key here. You have to persistently practice. It is a long process because the problem that you have got that did not happen over a day. It is because of years of wrongdoings that we have done, wrong postures and wrong practices. So to set all that right, you have a long journey. So you have to be patient and trust your therapist. You have to really do that. So we have met up with Ready Reckoner. If you cannot remember the whole presentation, just remember this one slide, which you can do in between your theater or whenever you feel like, okay, I want to do a short session of yoga. These are the go-to asanas, the initial shoulder stretches that we did with a stole, later the back bend, front bend, the cat and cow, and lastly the child's pose. So this would kind of take care of basics are sorted. Huge thanks to my team, without which this would not have been possible. And I'm very grateful for this picture. I'll preserve it all my life. Thank you so much for the opportunity.
Thank you, Shweta, and thanks for that wonderful demonstrations. Quick questions that has been posted. One is both directed to Dr. Cyril. So Dr. Pradeep, who had earlier spoken, he said that he had some kind of cervical issues. So people who have already had these issues or disc prolapse and thing, can they do the stretch exercises or strength building exercises which I had advocated? Can they do it? Or should they always go to their orthopedician or neurosurgeon, get their guidance and only then do, or come to you and then do, or they can start doing these simple exercises?
Okay, sure. That's a very good question. I'm sorry I missed mentioning about people who are already suffering with something. It just goes by, you know your body, you know the limitations, and if you want to do it yourself, please listen to your body. Where does it really give you pains and aches and stuff? So do not overdo it. And that's what Dr. Surya was also mentioning about being more mindful about your movement. Now, if you really already have a problem, was that treated? And all of us know that there are different grades of, say, disc prolapse. So if the milder grades, they always heal completely. And we are not incapacitated for life. So we are just back to normal. And we just have to, in fact, regain our movement somehow. So immobility is never going to be the solution. And most importantly, take it out of your head that there are this kind of limitations with you actually. Okay, you need to be more careful. That's the point. So when you are doing it, maybe one particular disc area you had a problem, but the others are also equally vulnerable. So it's good to get a supervised at least 1 week or 2 weeks. So we also do have a dedicated professional yoga therapist as part of this entire program. So we really understand what works best for the person and then tailor make it. So a person who's already having any kind of physiological or anatomical issues or a pathological problem, it's always good to get it completely screened and then get what is most suitable for it. It's like we prescribe medicines according to each person's, the markers, that the body markers that comes out of it actually. So that exactly goes with the exercises also, because you need to be a little more careful. Because in the first place, you got the spinal problem because of some lacunae. So that's the point. Yeah.
Thank you, sir. And another quick question was, Dr. Dhanishri Ratra had, Madam had posted that the body makeup of a gentleman and a lady is totally different. So should we build up much more to do the same kind of work between a gentleman and a lady? Should they always build up their muscle to that extent and then do, or is it that the same kind of an exercise is good enough?
Okay, good question. Body composition is what we talk about it, the lean mass, the muscle mass and everything, the fat mass. So it is definitely different among the genders, for men and women. So women usually have more proportionate, the distribution of fat mass, and men usually tend to have more of a muscle mass. So that is how we are built. So there's no point in looking at, so nobody's at any loss. I can guarantee that. So they both are susceptible to obesity over a period of time. So the health consequences also vary with the kind of the work-related exposure of strain that you get into. But having said that, the answer to your question is, we just have to compete with ourselves. It's just that how I am today, how much is my thing. And there's this one simple point that I want to tell us: with age, we do lose a lot of muscle mass, and because of inactivity and all those things. And this kind of a job, yes, you are at more risk of losing it if, as Dr. Natarajan was telling, if you don't get into an active lifestyle with preventive conditioning. So we call it as preventive conditioning. So even a person at 60 years, 70 and 80 years, even that person is expected to do preventive conditioning, strengthening exercises. So it's always good to get on to a strengthening exercise along with all the other things that we mentioned, if you feel that you are really becoming a little more imbalanced in your body because of the muscle mass loss, especially if there is a pathological underlying condition for that. Otherwise, you don't need to really compare between the sexes or between the people. We are all different, actually. We all have certain advantage and disadvantage because of this, differences. We just have to compete with ourselves. We just have to be the better version of ourselves as we grow older. So just be more protective. Prevention is the cure over here, actually. So it's just preventive conditioning, strengthening exercise.
Just a quick thing. The other panelists, Kim sir, Munna madam, Muralidhar sir, there's anything to be added upon or anything to be sorted from the previous talks?
So what do they all do to keep themselves fit, the panelists?
How many exercises per day?
Can you hear me?
Yeah, Dr. Murali.
Yes, sir. Muralidhar sir.
Yeah. I mean, I actually do a bit of yoga and jogging and walking. And I think at least about 60 minutes a day is what we need to spend on ourselves every day. This is a bare minimum, 30 to 60 minutes minimum we need to spend. And as Shweta said, you don't have to be, able to do the complete, bending. Whatever your body can do, you keep doing, and over a period of time, your body will definitely become more lax and more supple. And I would definitely recommend everyone should have a fitness regime for at least the minimum 30, and desirable is about 60 minutes. And that's what I do.
Munna madam.
I can't say I'm the most disciplined person, but I was so glad to see Shweta's presentation, and I realize I'm doing the similar things, though to much lesser levels than she is. So I guess that's it. And plus, I think many of us have our household responsibilities to run, walking up the stairs instead of taking the lift and things like that. I think whatever said and done, that does add to our unconscious fitness regime.
Kim sir.
Well, I'm not a regular. I wish I was like Dr. Muralidhar, but it's all on need base. Every time a pain comes, it sends me a reminder, and then there's an exercise regime for a few weeks, and then it slows down until the next shock comes. So, we realize only when we are having the pain, the need for doing all this. But when the other priorities come, this somehow takes a backseat. But I agree, we all need to be very conscious of this and continue to do this on a regular basis. Thank you, that's Cyril. And the two talks were excellent eye-opener for us.
Sir, can I ask Dr. Natarajan? You don't have to ask him because he either dances or flexes. So that's so big, I think.
You're not audible, Kumar.
Sir, can LG sir can also put sir's input, sir.
He should.
No, I started to run actually for the last 3-4 years, and I find that is running itself is a very good exercise. It keeps you trim, and you exercise a lot of muscles while you run. Plus, because you don't want your muscles to go into spasm, you stretch also. So some of the stretches exercise which have been taught today, they are something which you incorporate into your routine immediately before and after you run. So I'm proud to say that over a period of 3 years, I've been able to run now about 6.5 kilometers or so per day. So at least 3 days a week, I run about 6.5 kilometers, which is a very good exercise. I think you can incorporate in your routine practice, because unless we spend energy, if we maintain the same eating habits as we grow old, it has to go somewhere, and that goes around your tummy. And I think it's easier to spend it rather than trying to control your eating. That is why I try to do exercise. Yeah.
Thanks a lot, sir. Shobit sir, you wanted to add upon to it, sir?
Well, I agree with Dr. Gopal, and You either cut down on your eating. What I do try to do cycling thrice a week and a combination of mild to moderate weight training with yoga twice a week. So it's alternate days. It keeps me in good state.
Mahesh, am I audible now?
Yes, sir.
Yes, sir. Yeah.
Yeah, I just like to sum it up in the form of two quotations, which I just thought right away. Keep talking to your body before the body starts talking to you, and swim by all means, but not necessarily in the vitreous.
Thank you, sir.
Yes, there's one question from Ribu. I think it's addressed to Dr. Sarit. So does heavy weights lifting heavy weights hamper or help the vitreoretinal surgeon performance in surgery?
Dr. Ribu, I'm sorry, this is actually a research question. So I think we need to really, probably we can take it up and try to do it. But I can say from one of my colleagues, there's one of the doctors here who's actually a heavyweight lifting champion. And she even recently competed in the Karnataka heavy lift championship as well. I see her the most energetic person. She's literally like flying in the entire hospital. So there must be something to do with what all the kind of extreme athletic sports that she has taken it up. But this is a typical research question. So I'm sorry, I do not have the answer at the moment because I do not want to say what just appeals to us. But these are has to be proven scientifically. But definitely you're not at a loss. And if you're doing it, wow, wonderful, congratulations. I mean, this is all what we all aspire to. But the point of the entire thing is any movement is the topic that we're talking about. Any movement in any format is good enough, actually. That's it.
Thank you, sir. Sir, we'll try to get a ready. Sir, we'll try to get a ready recorder for the for the exercises. I'll coordinate with the Dr. Saril and Shweta and get it done. Thank you, sir. I think we are already overshot by about 20 minutes.
I'll just make one comment, Rajesh.
Yes, sir.
No, like very heavy weights does increase the tremor. So my heavy weights are like weights enough to tone the muscles rather than very heavy weights probably increase the tremor during your surgery. Thanks, Rajesh. I think I'll invite Dr. Kumar. Please, Dr. Kumar, we'll go on with the third session, please.
Thank you very much, Dr. Mahesh. At the outset, I must congratulate you for really arranging this offbeat program, which really it talks about the elephant in the room, a subject which most of us would rather avoid, the hot potato, as it were. We now switch gears and move on from toning up the physical body to moving to a zone which controls the motor orchestra, as it were. I have great pleasure in inviting and introducing my very dear teacher, Dr. Lingam Gopal. Introducing Dr. Lingam Gopal to an ophthalmic fraternity would be the proverbial carrying colt to Newcastle. But even so, we have many youngsters who have joined the group, and to them, I must say that Dr. Lingam Gopal, as a human being, far supersedes Dr. Lingam Gopal as a vitreoretinal surgeon. If we juxtapose Dr. Lingam Gopal, a human being, he's humble, his humility and humble to a fault, virtually. He answers the silliest question from anybody. And, he has been such a wide-eyed student of ophthalmology all along that his ophthalmic brilliance pales to insignificance. To talk about his ophthalmic brilliance, he's a skillful surgeon, an astute clinician with an encyclopedic scholarship in his chosen domain. He's been a mentor to all of us. And I have great pleasure in welcoming you, sir, to talk about a very, very important aspect about mental health as far as vitreoretinal surgeons are concerned. Dr. Lingam Gopal, please.
Share the screen first. Are my slides visible?
Yes, sir.
Yeah. At the outset, I would like to thank again Dr. Mahesh for even considering this concept of well-being of vitreoretinal surgery as an important seminar subject. And I would like to thank my dear friend, Dr. Kumar, for that wonderful introduction, which my mother will be very proud of. The topic given to me is the mental well-being of vitreoretinal surgeon, clinician's perspective. In the context, I'm sorry, it's not context, but context of a VR surgeon, mental wellness can perhaps be defined as a state of mental equilibrium that permits optimal care to the patient. So the factors that can influence the mental wellness can be work-related, personal issues, but both can affect the functioning of the VR surgeon in terms of delivery of optimal care to the patient. As we take our problems at home to work and backwards too. So burnout refers to a syndrome of depersonalization, emotional exhaustion, and feeling of reduced achievement. In fact, there are studies which have shown that it is believed to affect almost 40% of surgeons and is associated with both direct adverse clinical outcomes and increased attrition from training programs. The risk factors for this burnout phenomena are, of course, workload, which is very important. And some studies have shown that private practitioners are more prone for this burnout compared to those in academic settings. I'm not sure what the cause is. Is it because they don't have as much interaction with other fellow doctors, etc.? And also there are some people who have inability to cope with the patient's suffering that affects them personally very badly. The others I won't talk too much about, the debt load, legal issues, lack of administrative support. And one important point I want to make mention, again, this is from studies, published data, that lady surgeons seem to be more prone for burnout phenomena than male surgeons, maybe because they have to deal with home as well as work much more vigorously than the men tend to bestow their attention on their family life. So the adverse effect of burnout is there are increased medical errors, which is perhaps bad because that can affect your practice and your patient care. Absenteeism can occur, and in extreme case, of course, you can go to depression and suicide, and depersonalization. So 3 terms which we deal with are sympathy, empathy, and compassion. If we go through the dictionary, sympathy says you understand the problem. Empathy says you understand and also feel for the patient. Well, compassion takes it a step beyond, that is, you understand, you feel for the patient, and also act upon it. So is it that it is a stepwise increase in your involvement from understanding to feeling for the patient and act on it? Not necessarily. It's a two-way phenomena. When you feel for the patient, you understand more about his or her problem and try to do even better. And when you act on it and see the outcome, it again makes you understand the disease better and manage it better, and also feel for the patient because you're interacting with the patient. So these are all two-way phenomena, not one-way phenomena. So what happens is, when you understand, but you don't feel for the patient, but you act on it, you become more impersonal, more robotic. Your treatment may be efficacious in terms of getting the final anatomical and visual outcome, but perhaps the satisfaction to the patient is not great because he doesn't see you as a human being, see you more as a robot administering the treatment. So if the treatment outcome is bad, then there can be repercussions. The patient will attribute everything to your lack of personal involvement. While if the outcome is good, probably you won't complain. Suppose your understanding is bad, but you feel really for the patient and act on it, the treatment will be ineffective because you don't understand the disease nor the treatment protocols well. And it may be, in fact, you may do unacceptable things because you want to do something for the patient, but you don't know what to do. And this can actually result in sometimes bad outcomes because you are doing things which are not meant for that particular disease process. But what happens very often in beginners is that the feeling for the patient is getting exaggerated out of proportion. And at the same time, their understanding is still not as great as for an experienced surgeon. But they want to act on it, obviously, because they're treating the patient. So this is very typical of beginner surgeons. They're shell-shocked if there's a complication or an adverse outcome. They're shell-shocked. They're unable to act appropriately. And in fact, they can go through a phase of denial of facts. This happens very often in initial cataract surgeons. When suppose they have a hypopyon, they don't want to accept that it can be endophthalmitis and act upon it appropriately. They're so shocked with that, which has happened to their patient, that they don't want to accept that it can be endophthalmitis. They treat the patient with just topical drops and let things happen. And then, of course, it becomes too late. So this is not something which we want them to go through. So what they should do is of course, improve upon it. We'll come to that a little later. You can feel for the patient. You can understand very well once you're experienced a little bit in the mid phase of your career. You understand the disease better, you're able to manage very well. But still, there are a few people who feel for the patient in a more exaggerated fashion than they should. When this becomes too much exaggerated, they're affected severely by the bad outcomes. And what can happen is, I'm not saying that you should not be sympathetic to the patient, but I'm only saying that your reaction should be not out of proportion to what has happened. When that happens, it can potentially affect your functioning at optimum levels and hence delivery of treatment to the subsequent patient as well. So this is where you need to control your emotions. So ideally, it should be a balance of understanding, balance of feeling for the patient and acting on it. Then you're able to deliver the best treatment. An adverse outcome can happen despite your best efforts, and that should trigger the positive features, not negative features. The positive features are you review the case and attempt to tweak and improve upon the processes. And that should actually give you better outcomes for the future, if not for this case. It's called grit and perseverance. And many studies have shown that people with grit and perseverance have the best achievement and outcome in the long run. So what are the protective factors against this burnout phenomena? One is, of course, a good work environment. If you're not happy with the place you're working, the colleagues with whom you're working, maybe it's better to change the environment. Sharing thoughts, this I thought is a very, very important thing. If you keep the failure within yourself or the adverse outcome within yourself, it really eats up into your brain and then makes you feel more and more depressed. So best is to share your success and failure with your peers and colleagues. Similarly, listen to stories from them. Literally having a shoulder to cry on, that really takes away some of the severity of the damage it can cause to your emotional well-being. Taking a more philosophical approach while dealing with cases with poor prognosis and adverse outcome. It's easier said than done, but with experience, you realize that you can handle these emotions reasonably well. Other protective factors are meditation, family holidays at regular intervals, attempting to learn something new over a period of time, 50 years and beyond. You get into a routine of your life, and then that can really have an adverse effect on your emotional outcome when you consistently operate on bad prognosis cases. So that's where you try to learn something new, different. I tried to learn something in between at the age of 55. I tried to learn epidemiology and biostatistics. It really helped me a lot because it exercises your brain, it stimulates your mind. And understand also that one cannot satisfy everyone. And keep a mirror to yourself in an objective manner. Don't sort of accuse yourself of not doing enough. So when there's a difficult case or outcome, you sort of itemize what all went wrong, which is very important because you want to make things better for your next case and subsequently. But also itemize what went right, because that's something you should strengthen. And don't blame yourself for what is clearly out of your control. And ask yourself, have I done my best? All these are important because that's what makes you better for the subsequent cases. And let each difficult case be a harbinger of improvisations. That's what I said, grit and perseverance. Emotions should be kept under check. I'm not saying you cannot have emotions because then you become a robot. You should have emotions, but they should be kept under check. And they should not overwhelm you and not allow you to improve yourself for the subsequent cases. Then if in the worst case, when you had a really, really bad case, a bad day, try to do something different on that day. Listen to good music, go to a movie, go to your best friend and spend time, etc. So that you come out of that very quickly. So the next day, there's no carryover effect. So when you deal with desperate patients and parents and grandparents who accompany patients with ROP stage 5, for example, one must become a little bit of a pachyderm. Pachyderm, I mean thick skin. You are sympathetic, you are compassionate, but you should not allow that to overwhelm you emotionally. Develop the art of resetting your emotimeter to 0 before you start the next patient. Otherwise, there's a carryover effect, and that can affect your management of subsequent patients. Thank you very much for your patient hearing.
Thank you very much, sir, for that excellent and erudite presentation. In fact, this whole discourse is based on the premise of physician heal thyself, or cura tipsum, as the Latin expression goes, that we need to be at our optimum to be giving the best to our patients. Although, sir, you covered it broadly, I would like you to dwell on this dichotomy of sorts that often confronts a vitreoretinal surgeon, particularly the beginners. If we are not able to perform surgery to the optimum in a given case, we may take it with a pinch of salt and in a philosophical way, when we may not be learning much. We may just say that the disease was too overwhelming and therefore it's the patient hard luck and we leave it there. So that may lead the vitreoretinal surgeon not to indulge in any introspection or learning. On the other hand, if he becomes overly critical about himself, self-deprecating himself for all the wrongs that went wrong, he may develop anxiety, depression, and stuff like that. So when we are faced with such a kind of a dichotomy, how do we really balance? Because that is the key to carrying on.
I think the key is to be as objective as you can be, and it is probably not possible on the same day that you had the event, but maybe the next day you can sit with your colleague. That's what I said. It's important to have somebody whom you can depend upon, whom you respect their opinion, sit with them and list out all the things that went wrong in that case. And also, as I said, list out all the things that went right. And subsequently, you try to see what you can tweak to make your surgery better, your approach to the treatment better. And also, there's nothing wrong in digging through the literature and see what others have done in the same situation, so that you know where probably there's a lacuna in your knowledge, fill it up now, because no human being is born perfect. And we have to make ourselves as perfect as we can with each case. So every case feeds some information, positive or negative. And even if you are not treating, if somebody else is treating and you're observing, even from that you can learn. So all this learning process helps us to sort of improve our positive points and reduce our negative points. And that's how you try to give the best best treatment to the patient. I don't think anybody can say that I have done my best at any given point of time and say this is the best that can be done. But yes, probably even better can be done. But that is something you need to evaluate at the end of each case.
Two other issues that I would like to discuss with you, sir. There might always be a feeling that a senior surgeon, however experienced the surgeon may be, someone better than him could have handled this better. So that kind of a feeling may always swamp the mind of a vitreoretinal surgeon sometimes. The second thing is, many times we have to throw in the towel and abandon a given case. Then also a sense of guilt may overwhelm us. So these two specific situations, I'd like you to throw light on.
No, there is no doubt that a more experienced surgeon can probably do things a little better. But there's always a gray area where there are some cases where nobody would have helped this guy, irrespective of who is operating. But there are some group of cases where you may believe that somebody else may have done a better job. If you had an opportunity to get such a help, by all means get the help. If it is within the same institute, if you are stuck with a situation where you are not able to solve, call your senior and ask them to help you out. No pride is involved there. You are only trying to help the patient do his best. So there you should take help. But if you are not able to take help on the table because it's impracticable, and if it is still possible to take an opinion from a patient afterwards, send the patient over to somebody like Dr. Mahesh and ask for help. Can you think you can do one more surgery and rectify this problem? But so this is where I think people should have to swallow their pride and try to do the best for the patient. But there are always, as you gain experience, you realize that, okay, this particular case, I don't think anybody would have helped. That is where I think you need to accept that is a human limitation, and then say that, okay, I have done my best.
Thank you very much, sir. Are there any other points of view from the other panelists or any queries to Dr. Gopal, please? Dr. Natarajan?
Yeah, so Kumar, thank you. Thank you, Gopal, for a wonderful talk. So you were mentioning about sharing bad experience or good experience with a colleague. I'm sure you remember when I was a fellow and Dr. Chief was starting the VR with all of us. We had a 8 to 9 daily meeting, grilling each other what happened the day before and what is the plan of action, and then including coming late about 8 to 8:30 every day we had. I think that really helped. And I remember one day, I think giant tear 6-9 with the macula on patients come, and we used to do that upside down surgery with the GA by Dr. Anthony Raj. And finally, I remember all the 9 patients, I think we had only PL post surgery because of the PVR. And he told, I'm not going to operate any giant tear. And I remember we both were doing it for some time, because I think any surgeon, even a person like Chi was the best VR surgeon all of us know, and that was in 85, 86. So I think Anybody will have fatigue, anybody will have upset. But I think the best was to share, saying that I can't do, and then give it to somebody. And he always asked, okay, can you do? And he used to share with Gopal, me, and Dr. C at that time, and also Arun Ellens as a fellow. I think we have to share. And I even now, I think now and then I call Gopal or Mahesh or even some VR surgeons, my friends in US, to share the experience, because sometimes the trauma patients are terrible, the expectations are terrible. So I think you have to promise less and deliver more.
Thank you, Dr. Natarajan. I think Karobaleri has a question, how to set your emotimeter to 0 in between cases. Dr. Gopal, would you please?
No, how? I don't know. It is
probably.
It is just your own, I mean, nobody can set it to 0, but as much towards 0 as possible, so that most important thing is it should not affect the rest of the day for you. And correct. I can share with you one story, which is a real story of a person who was operating in a relatively small town where there are no other doctors available except that particular surgeon. And he was operating, and then when he opened the abdomen, something happened. I don't know what exactly was the story, but he got so upset, he left the patient on the table and walked away, never to return. He went and committed suicide, that surgeon. And the patient's abdomen was open. And the relatives had to take the patient with the abdomen open, covered with gauze pieces and all, to the nearest town while the patient was under sedation, and try to repair the abdominal wound. So that is one extreme where the emotimeter could not be brought down at all. What I'm trying to say is, to the extent human beings can set their emotimeter to 0, please do that, so that you don't have a carryover effect for the rest of the day.
Yes, sir. It's just like trying to stay in the moment, as they say. And if you have to draw an analogy from the game of cricket, if a batsman is badly beaten by a previous delivery, you should not be dwelling on that. Otherwise, he may get out the next ball. You should forget about it and concentrate on the next ball. Absolutely. Something similar. And to discuss the issue of sharing, many times that helps in many ways. There is a Persian proverb, it goes this way, that I was cursing that I had no pair of shoes till I saw a person who had no feet. Whereas, and a more experienced person may have experienced greater difficulties. When you come to know about that, you tend to feel a lot better. I think in the interest of time, Dr. Mahesh, should we move on, or are there any other points of discussion?
Yeah, sure, Dr. Kumar. I think Dr. Natarajan wanted to make a comment and last comment, and then we can go on to the next topic.
I think I agree. One is, I think we should go for counseling. There's no problem of feeling that you're low, and if you can't do immediately between cases, as Dr. Gopal said, like this is an extreme case. I think if you're constantly in touch with somebody, like I could not manage when my grandmother passed away, and it was terrible. So I went and did a course on with a cognitive scientist for 90 hours. That means I paid for it, but it's worth it. Either you go to a counselor or go to somebody like that, or do an exercise or yoga or something, as Dr. Gopal said, even music. But you have to identify that you have a problem. And that is it's a mental issue. It's not a mental problem. But I think you have to be mentally strong. So one is prayer, and the prayer with faith. And the second is go for counseling. Whatever type of counseling it will be, I think that will help. Because everybody will face this problem, particularly if you're only doing VR surgery. So no case will be the same every day. And then you may think the simple case and you'll go for terrible from a 6-9 to PL, and they will keep on to you. And I face it even today. But I think you have to learn to, instead of living with it, that's the wrong term. You have to find how to cope up with it. That's why I said you should not react. You should actually respond. And that's a management issue also. Any problem comes, everybody reacts. And that's where I think we get angry and we shout all that. So I think the best is to respond. So for example, some patient is shouting outside. When the patient comes, one thing I don't even ask what is the problem. I just start them, what is their eye problem? So he immediately forgets everything. So I think you have to find a way how to tackle it.
Yeah, there are many ways to skin a cat, and we must try and figure out each one of those and what works best for us. I now have great pleasure in inviting the speaker for the concluding talk today. It is Mr. Srijit Casey. He has 18 years of corporate experience and currently works for Dell as a director in product strategy, and had been associated with Air India and Infosys in the recent past. He holds a full-time MBA from the Indian Institute of Management, Kolkata, in marketing, and BTech in electronics engineering from Cochin University. He is a senior corporate faculty with the Art of Living Foundation and has facilitated trainings for leaders from across the industries on leadership tenets and achieving holistic excellence. He is also passionate about Ayurveda and holistic wellness and is a co-founder of an Ayurvedic wellness center based in Bangalore. Welcome, Mr. Srijit. As you can see from this illustrious biodata, he's a holistic person himself. He will talk to us on meditation techniques.
Thank you, Dr. Kumar, for the kind introduction. So, a very good afternoon to everyone. Just 15 minutes past the afternoon. So, and thank you, Dr. Mahesh, for inviting me. And I was a little wary of joining this webinar because I found that I'm the only non-medical professional in the whole. Somebody is on unmute. Okay. So thank you. So I was a little wary of addressing medical professional when I'm the only non-medical professional in the whole audience and the whole panel, right? So without much ado, let me get into the topic, right? So the topic I've given is the meditation and the mental well-being. Okay, so I'm here for the last 1 hour, so really excellent presentations and perspective from all the fellow panelists, right? Mostly talking about the postures, how to manage the emotional part of it. And I would say this session of mine would be complementing that, right? And I don't have a presentation, because it's very difficult to put all this mental well-being on a presentation, right? Rather, I think I would give you a real experience, So that's my plan. That's how I structured my 10 minutes. I have already passed 1 minute now. So if you see any profession, for you to be successful, you need to focus, right? Regardless, whether you're an eye surgeon or a pilot or an engineer, what you really need is focus, right? You need to focus on the activity that is in hand. But if you see that, if you only focus for a long period of time and you don't relax, that can cause all these kind of issues that we just talked about, right? It can be a posture issue from a physical standpoint. It can be stress from a mental standpoint. Hence, to be successful in any of your professions that we do is the ability to focus and at the same time, ability to relax. And if you see, many times when you focus, we are not relaxed. And when we are relaxed, we are not focused, right? Now, is it possible to have a state of mind where you're focused, at the same time, you're relaxed, right? And that's $1 million question, right? So that's what I'm going to address now. How to be focused and at the same time, how to be relaxed, right? Now, many times you think, okay, I need to be focused and I want to be relaxed. I can decide, right? But body and mind works at two different principles. So if you want a six-pack body, you can't just relax and say, let the six-pack come. It doesn't happen, right? If you want a six-pack body, you need to go and work out in the gym, right? But if you want a six-pack mind, you need to learn how to relax, yeah? So telling yourself how to relax is like me telling you right now, do not think about a monkey. The moment I told you not to think about a monkey, you already thought about it, right? It's so difficult to tell the mind to do what you want to do, right? So hence, how to manage the mind is through the breath, right? If you observe, every emotion that you go through has a specific rhythm of breath. For example, how do you breathe when you're angry? If you observe, when you're angry, you breathe faster. Regardless which part, what profession you do, which part of the world you are in, it doesn't matter. It's a universal law that when you're angry, you breathe faster and shallow. And when you're sad, you breathe out a long sigh of breath, right? And when you're happy, the incoming breath is more and the outgoing breath is slow. And this proves that every emotion that we go through has a specific breath pattern, right? So the trick of managing the mind is through the breath. As I said, every emotion affects your breath. Now I would say the converse is also true, which means managing the breath, you can also manage the mind, right? And as I said, it's easy to talk so many things about mind, but difficult to practice, yeah? So I thought I would give you a 3 minutes of experiential session rather than talking a lot about it, yeah? So one way all of us can do, I mean, regardless whether you're a surgeon or any other profession, if you're into an activity which requires a lot of focus, is something called Nadi Shodhan Pranayam. It's called Nadi Shodhan Pranayam. Yeah, so it's very simple. So Nadi Shodhan Pranayam, what it does is it cleanses all the energy channels in your system within a couple of minutes. Yeah. So how do you do it? It's very simple. So what you do is you can close your right nostril and slowly breathe in through your left nostril. Now close your left nostril and slowly breathe out through the right. Now breathe in through the right nostril and breathe out through the left. And continue left to right and right to left. And keep your attention between your eyebrows. Keep the spine erect and attention on the breath. Slow breaths in and out. Just one more round. And this time, as you breathe out through your left nostril, you can relax your hand. And once you have done with the breathing out through the left nostril, you may relax and close your eyes. You can sit with your eyes closed and first listen to any noises around you in the room. If could be people are talking to you, talking around you, maybe sound of the traffic, the birds chirping, any sound around you. Listen to it and relax. But listen to them keenly. And let's breathe in and slowly breathe out. Now, become aware of your own body. Take your attention to your own body. Let us become aware of our feet. Become aware of your knees, the calf muscles, and the knees. The thighs and hips. Become aware of both your legs Let's take a breath in and slowly breathe out. Now become aware of your lower abdomen region, the genitals, lower abdomen. Become aware of your navel and the stomach region. Become aware of your chest region, the shoulders and arms. The neck and throat, face, the head, and the whole body. Relax your whole body. Let's take one more breath in and slowly breathe out. And as you breathe out, feel the weight of your body on the chair where you're sitting. Now become aware of your breath. Observe your incoming breath and the outgoing breath. As you're breathing in, you would notice that your body is getting a little tensed. The body is becoming a little tight. And as you are breathing out, you feel the relaxation in your chest region and the whole body, in fact. Now observe the thoughts in your mind. Whether they are good thoughts or bad thoughts, do not resist. Just be a witness to all the thoughts in your mind and welcome them. Let the thoughts come. Keep looking at your thoughts. Do not leave a single thought unattended. And welcome them. Breathe in and slowly breathe out. Now become aware of the feelings you're having right now. Observe how you're feeling. Pleasant or unpleasant, do not resist. Just observe the way you're feeling right now. Pleasant, unpleasant, maybe impatient or impatient. Just observe your feelings. Breathe in and slowly breathe out. Relax completely. You are peace and you are joy. Again, become aware of your feelings, the thoughts in your mind, if any, your own body, the environment, and very slowly, whenever you feel like, you may open your eyes. You may slowly open your eyes and observe how you were when you closed your eyes, and observe how you're feeling right now. And there will be a sea of difference if you have done it properly, if you've closed your eyes. Am I right? Yeah, at least I can see Dr. Kumar and Dr. Saril. I can look at your face. I don't need your answer. So this is it. That's it. Yeah. So all the experience speaks a million words. Yeah. So, but you cannot learn how to fight a war in the war field. Isn't it? Same thing, you cannot learn to be relaxed while at work if you haven't been trained so. So I would say that regardless of whatever profession you are in, every day morning, if you spend 15 minutes for yourself, being selfish, if you're 15 minutes selfish for yourself, rest of the time you will be more productive when you're selfless. Yeah, that's the message I have for all of you. And there are a lot of guided meditation by Art of Living in YouTube. You can just put one of them and then just practice meditation every day morning, 15 minutes. You can just do this Nadi Shodhan Pranayam. If you have any surgery happening, you can just do it before 2 minutes before your surgery, 5 minutes. You would see that you will go with a much calmer mind. You're more focused and relaxed at the same time. And with that thought, I would hand over to our moderator, Dr. Kumar. If you have any questions, I'm ready to answer. Thank you.
Thank you so much, sir, for that experiential exercise that you put us through. I'm sure every one of us enjoyed it really. And I have a query for you. Most of us lament that we are too busy for all this. And as somebody said, it's like a busy driver who says he's too busy driving and he has no time to even fill gas in the vehicle. So if we don't find time for ourselves, then the vehicle will stop some time or the other. So we definitely need to carve out some time from our daily routines for ourselves. But I have a question for you. Many times we go through our surgical lists of the surgeries that we have merely by muscle memory. And as we are operating, we are thinking about something else. We are thinking about how to tackle the patients in the outpatient after the surgery, or thinking about the next case that is coming in, etc. And we wonder at the end of the day how we went through the list. And if we just go through that, we many times have done it from muscle memory. Now, can surgery, the very act of surgery itself, be treated as meditation and focus intensely on the particular step of surgery that we are doing, so that the two benefits, we can avoid doing meditation separately. And if you're meditating on your surgery, you can pick up any problems at an early stage so that the surgery itself can be controlled. So any complication can be addressed immediately. So what are your thoughts on this?
Okay, so good question. In fact, there are multiple questions. I will address one by one. I'll start with a beautiful quote by Mahatma Gandhi. So he said, "Today I'm very busy, so I'll meditate twice." Yeah. And second thing about your two questions, which are slightly contradictory with each within themselves. One you said is, while you're performing surgery, we sometimes think about outpatient. The moment you're performing surgery with your muscle memory and you're thinking about the patients outside, that's not meditation. But when you are really 100% into that surgery, you are right. It's a meditation in itself, right? So good question. So how do you manage this? And when you see anything that happens through your muscle memory, you cannot innovate. Muscle memory is something which you have been trained, you're doing. But if there are some I don't know about anything about the eye surgery, but if there is something you need to innovate in the present moment, if it's muscle memory, you cannot innovate. So when you meditate, you get that skill to be innovative in the present moment. You can be spontaneous, which as the situation is required, right? And about not having time for meditation. See, we have in everyday morning, however busy we are, we brush our teeth, right? We never say that, hey, I'm very busy, so I didn't brush the teeth today. So you stink. Same thing happens when you don't clean our mind, right? So like dental well-being is very important. I would say that mental being is more important, right? Now, any kind of profession, you see that there is depression, there is stress everywhere, right? It's like almost second to God, omnipresent is stress, right? So I would say that regardless of your profession, if you start the day with meditation, what I've seen is that you'll be more productive because your mind stays in the present moment, and you'll be more effective at your work.
Right, sir. A sound mind in a sound body, as the expression goes. And all of us are really a cocktail of the chemicals in the brain. As men of science, we should be aware that we should be trying to produce the right kind of chemicals in the brain so that the motor functions happen optimally. So an excellent talk by Mr. Srijit. Any other queries from the
Dr.
panelists?
Muralidhar has a question
I
or a
have
comment.
one question to Srijit. Often I used to actually put on music when I'm doing surgery.
Yeah.
And sometimes I'm not sure, I'm ambivalent whether it is really helping me or not, or distracting me. Sometimes I feel it is distracting me because I'm listening to a nice Ragalapna or Muhammad Rafi in the background. Sometimes I feel it is helping me. What are your views on that? Does putting a music like this during your surgery, is it advisable, not advisable, or what is your take on that? And others' take also on this, I would like to know.
Thank you, Dr. Muralidhar. So good question. See, our brain has two parts. All of you know that you've been doctors. You're more expert in that. So left brain is logic, science. Right brain is art and music. Yes. And if you see, when you have to do your work, your surgery, you need to 100% be on the left brain because you're thinking, you need to do what's the next procedure, you need to plan. That's all left brain. But many times when you play the background music, you see more relaxation because the right brain also gets activated, right? So there is nothing wrong in putting the music behind while you're doing. I mean, that's not a bad, as long as it's not very loud and disturbing for others, I would say it will help you relax, right? So there's nothing wrong doing that. Yeah.
Murli, I think, I don't know whether I'm right or wrong, probably an instrumental music may not distract you as much as vocal music, because then you start identifying with the singer and go into the details of style of singing and stuff like that. Maybe light instrumental music, as we see in the background on many airplanes as we get in there. So that kind of a lilting, soft music in the background may be soothing, more soothing than stirring up your passions as listening to a vocal singer. I don't know whether I'm right or wrong.
Not really, Kumar, because I'm sure all of us have my MS songs in our head. I've listened to it over and over in Shankanetran.
I think it sure relaxes the surgeon to some extent, more so over the patient. I many times, for normal surgery, not when I'm doing a very complex surgery, I many times ask the patient what he would like to hear in the background, and a low volume music to that effect really helps in relaxing the patient. That's what I've observed.
So if there are no other comments, Mahesh, maybe decide to call it a day and conclude today's meeting.
Thank you. Thank you very much.
Before we end, Mahesh, because you are now the chairman of the scientific committee of VRSI, just a thought, there is not much of material available on the net either when discussing topics of this kind. So can we have a subunit of RedNet dedicated to collecting data on some of these things maybe confidential also, and then putting up some of the thoughts that come in there to generate data about these aspects, particularly mental well-being among vitreoretinal surgeons.
Collecting data and blackmailing people. As a VRSI initiative also, yeah.
Sure. I'll work on it. As I said, as Dr. Sarin wanted to work on the ergonomics part of it, and I'm sure we can do that. We'll work on it, Kumar. And it's my pleasant duty to thank you all and thank the wonderful talks by Dr. Lingam Gopal, Dr. Sarin, Mr. Srijit, Dr. Saravanan, Pradeep, and Shweta. So I hope all of you enjoyed it as much as I enjoyed putting it together and listening to it over the last 2.5 hours. I'm sorry we are delayed by about half an hour. I hope that all of you enjoyed it. And the panel for their wonderful insights, Dr. Muralidhar, Dr. Kim, Dr. Shobit, Munna, and Dr. Natarajan. And thanks to the wonderful work by the moderators, Kumar, Madhukumar, and Rajesh. Thank you very much. I hope it was a Sunday well spent, and I thank the guest speakers for spending their Sunday educating all of us. Thank you very much. And VRSI abstract submission is open, and it's likely to close by 15 June. Whoever wants to please register and send in your abstract. Thank you very much. And yes,
just a light movement. The only person who is sitting straight throughout the meet is Dr. Pradeep only, sir.
He's supported by the wall in the back. If all of you can turn on your videos, we'll just take one snapshot.
Yeah, I would like to congratulate Mahesh for putting together such a wonderful and a timely program, which was never done earlier. And I suggest we can bring out a booklet on behalf of VRSI on this subject. Probably it would serve a very useful purpose to all the members also, to kind of keep them as healthy and as productive as possible. So kindly look into the matter whether the next newsletter of VRSI itself can have some articles on this, or whole issue can be devoted to the well-being of vitreoretinal surgeon, the topics what we had, and you can even enlarge it, and that can have a section of exercises and what all the videos were shown and all that. If not the videos, at least the photographs or the diagrams could enhance the entire this one. So kindly think about it, Mahesh, and thanks
sure,
again,
Dr.
Mahesh.
I think
team
this itself will go.
Wonderful job. Thank you.
This itself will be a recorded version will be available, but I'm sure Rajesh is collecting the. I think it's going to
recognize for the
both yoga as well as thing. I'm sure he'll be able to do that.
Thank you. Thank you very much.
Yeah, thank you very much.
Thanks, sir.
Thank you.
Thank you. Thanks, everyone.
Yeah, bye.
Thank you, everyone. Bye.
Thank you.
Thank you, Mahesh.